not pictured here because it's laying flat. And then you have your auditory nerve up to your brain. So those are kind of the parts and pieces of your ear heading up to your brain. Now, when it comes to function, sound is going to travel into your ear as sound waves or acoustic energy. And the acoustic energy is going to hit the eardrum and cause it to start to vibrate. When that happens, the energy gets transferred and turns into a mechanical energy, which then vibrates the bones of the middle ear. Those middle ear bones do a little shimmy shake, and the last bone, called the stapes, acts as like a foot plate and will actually physically push on something called the oval window of the cochlea. So this oval window is going to be kind of like a membrane. So when it gets pushed in the cochlea, there is fluid that's supposed to be there, and it starts this traveling wave of fluid. So now we're converting the energy for a third time into fluid energy, which travels through the entire cochlea. Also inside the cochlea, you're going to have a couple more membranes. You have something called the basilar membrane. This is where all of these little tiny stereocilia or hair cells are sitting. And on top of those hair cells is the tectorial membrane. So as this fluid washes through, that tectorial membrane will move over the tops of the hair cells, bending them. When that happens, the energy gets converted for a fourth time into chemical energy, and there's a chemical reaction that occurs in the hair cell, which then gets converted for a fifth time into electrical energy, which goes up to your brain. And the reason why I like to highlight this is because that's a lot of changes that happen in a very short, fast period of time. It's just an amazing system how this works. Now, your cochlea is this like the second smallest organ in your body. It is about the size of a pea. On the left-hand side of your screen here, you're going to see a microscopic view of the cochlea, which has 2 3/4 turns, and it's arranged like a piano. So all of those little hair cells are arranged what's called tonotopically. So at the base of your cochlea, you're going to have all your high frequency sounds, and as it swirls towards the top, it's getting lower and lower frequency. Um, this is why when you have loud noises coming in, you're going to have a lot of vibration coming in, a lot of fluid moving through in that membrane. That tectorial membrane is going to really wash over the high frequency sounds first. That tends to damage them first if there's a loud noise. So some people ask me, why do I lose my high frequencies first? That's why. Now we're going to getting even more microscopic. These are the hair cells in the cochlea. This is a normal view of that. You're going to have 1 row of outer hair cells and 3 rows of inner hair cells. I'm sorry, 1 row of inner hair cells, 3 rows of outer hair cells. You have about 16,000 hair cells in each ear. So there's a lot of redundancies in the system that are helping you hear. A normal hearing system for a human is from 20 hertz to 20,000 hertz. So we can hear lots of different sounds. Now, each of these hair cells types are going to have different functions. So your outer hair cells are going to be more your volume control knobs, if you will. So they're communicating with the brain. Brain is communicating back with your ear, and they're kind of controlling the volume. The inner hair cells are really in charge of converting the energy from the chemical to the electrical to get the signal to the brain. A lot of times we're going to have damage more into the outer hair cells, which can cause us to have some hearing loss. Now, this next picture, I wanted to show the difference between normal hair cells on the left-hand side of your screen versus damaged, severe damage on the right-hand side of your screen. So you can see that there's a lot of hair cells missing here. This is someone with very severe hearing loss. This is another picture that is showing some damage, but on the left, you have a nice normal outer hair cell bundle. And on the right, you're going to have a little bit of bending that's happening. You can see that there's not much damage here, but other than a little bit of bending. But if you remember from 2 slides ago, I mentioned when the hair cell bends, that can create a chemical reaction, which results in electrical energy going up to your brain. So one of the theories with tinnitus is that you may have some bent hair cells that might be sending a signal up. A second theory that we're going to discuss a little bit more is that the brain, if it thinks that there's something missing, might be checking for what is missing. Or another thing that can happen is that if the brain thinks it's in danger, it can also be checking for sound. So again, you have an up and down system. both things can happen both ways. Now, if you do have hearing loss, the most common type of hearing loss is going to be that high frequency hearing loss. So if you see an audiologist, you're going to have a test that's going to plot you a lovely graph of your hearing, and it may or may not look something like this. There's lots of different types of hearing loss, lots of different shapes of the graph, but this is probably the most common, where on the left-hand side of the graph, you're going to have lower frequencies. And when those frequencies are plotted towards the top of the graph, they are showing normal or really good hearing. As the graph gets kind of sloped down towards the right-hand side, those are your high frequencies, and it's taking more energy for you to hear those sounds. So that's just an example of a hearing test. Now, some of you might be telling me, I have a normal hearing test. What does that mean? Well, when we test your hearing, we are only testing sounds that you would hear for the English speech frequencies. So we're only testing 250 to 8,000 hertz. As I mentioned earlier, normally we hear from 20 hertz to 20,000 hertz. So we're only getting a snapshot. So it is possible that we're not getting all the information with a hearing test, and we're only getting a little piece of the puzzle. So you can actually have 30% damage and not even know it if this is your hearing test. So usually the next question I get is, well, is there other tests that I can have done if I'm showing that I have normal hearing and I just want to make sure that my tinnitus may or may not be from the cochlear aspect. So you can have what's called ultra high frequency testing. That's going to test beyond 8,000 hertz. So getting those really high frequencies that are beyond the speech spectrum. You can have speech and noise testing that's going to check to see how well you hear in noise. You can have something called an auditory brainstem response test. That's checking the nerve and how the nerve is functioning to the brain. And you can have something called DPOAEs. So these tests, that test in particular, is actually checking the hair cells to seeing how they are functioning. So for my example, with my hearing, I have a normal graph. But when I have an OAE testing, it does show some damage because I had noise exposure when I was younger. So those are some other tests that you can have done that you can ask for. They're not necessarily needed, but if you're like curious if this is a problem, this is something you can do. Okay, moving along. So now when the sound is leaving the cochlea and it's heading up to the brain, it has to go through what I like to call different processing centers. So the very first processing center is going to be the dorsal cochlear nucleus. And this is where the auditory nerve innervates, but this is where other parts of nerves are going to innervate as well. So for example, if you have neck or jaw issues, the trigeminal nerve may be sending some signals here to the dorsal cochlear nucleus, overexciting it, and then sending it up as an auditory signal. So sometimes people tell me their tinnitus changes with jaw or neck motions, and that's going to be from that trigeminal nerve overexciting the dorsal cochlear nucleus. So once the guy gets that information, all he does is he passes it along onto the next section, which is the superior olivary complex. And it's going to send it to the same side of the information, but also send the information to the other side. So the right and left get information from each other. When it's at the superior olivary complex, what happens is that guy is saying, okay, well, where did the sound come from? Was it my right ear? Was it my left ear? Was it in front of me? Was it in back of me? Where did it come from? And it's going to mark the electrical signal and send it up to the next section. The next part is the inferior colliculus. So that guy's job is to say, okay, well, what frequencies were on this pitch or this frequency, this electrical sound, and I'm going to mark it. But it also is going to look for non-auditory cues. So did I see her mouth move as I heard her talk? Did I smell the bacon as I heard it sizzle? Did I touch the keys on the keyboard as I heard them click? It's adding those information in and sending it up even more. Finally to the medial geniculate body. And we're going to talk about the medial geniculate body in a little bit more detail. This guy is kind of like a gatekeeper before the brain. So the medial geniculate body acts as an air traffic controller. It's going to communicate to the brain. The brain is communicating to the medial geniculate body. So it's kind of focusing its attention on sound. It's linking the emotion and the meaning to the sound. It can change with context. And inside this medial geniculate body are these relay cells that can actually mark the signal as not important. I hear it, but I don't care. It's important. I hear it. I want to pay attention to it. Or danger. I hear it and I need to now do an action. So this communication with the brain happens in this medial geniculate body where these signals are getting kind of tagged with importance. So one of the theories here is the medial geniculate body is finding the tinnitus signal and marking it as danger, as an alert. And that is what starts now a whole nother aspect of things that happen in the brain. So in the brain, you have 4 different lobes. You have your frontal lobe, which is in charge of attention, decision making, planning. Your parietal lobe, which is in charge of touch and taste. Your occipital lobe, which is in charge of vision. And you have your temporal lobe, which is in charge of your hearing, memory. And then it's not a lobe, but it's important to mention your cerebellum, which is in charge of heart rate, respiration, breath, and whatnot. So it gets to the brain is getting it. It might communicate back with the system and go, okay, what did you give me? The system is sending information back up and down, up and down. And then what happens is the brain actually is going to change. So you have this tinnitus signal get to your brain as danger. That's going to turn on the autonomic nervous system and the sympathetic nervous system. These guys are in charge of stress and alert and keeping you out of danger. So they turn on. Now, when they turn on, they're going to direct the amygdala to turn on. The amygdala is your fire alarm, like, uh-oh, there's danger. It's going to speed up your heart rate. It's going to make your breath shallow. It's going to make your muscles tighten. And when the amygdala turns on, your prefrontal cortex, which is in charge of decision making, steps aside and says, you know what, we're in danger. I need to let these guys take control. Because in a real life dangerous situation, you would want them to. Unfortunately, with tinnitus, it's not dangerous. It's not a tiger chasing us. But it's still turning these systems on. Other changes that start to occur is you have something called your hippocampus. That is your brain's emotional memory center. So he remembers everything and he's going to remember the emotion that goes with it. So he's now remembered that your tinnitus is dangerous and he's going to log that. Basal ganglia is in charge of routines and patterns. So it's going to keep this tinnitus in a loop because it's like the whole brain's trying to figure out what's happening. You also have something called neuroception. So neuroception is really kind of keeping you in alert. Is that a problem? Is that too loud? Is that too sharp? What is going on? Alert, alert. So it's keeping you in this heightened state of alert as well. And then you have also the default mode network. This guy likes to tell you stories. So when the sound is coming and it thinks that it's dangerous, it's going to start telling you these automatic negative thoughts of, oh my gosh, is this ever going to go away? Is it always going to stay this loud? How am I going to deal with this? This is the one that kind of tells that tinnitus story on a loop, that he likes to lie to you because he doesn't know. He's just reacting completely off of all the things that are flooding your brain. Then you also have white matter tracks that change in your brain. So all of this is happening very quickly. These white matter tracks change in your brain and they develop because the tracks for tinnitus are trying to look, where is the sound coming from? I don't have any information from my outside world. I don't have my sight, my smell, my touch, my taste. So it starts looking for it. Where is this coming from? And asking all of the different parts of your brain. So we can actually they had some studies that showed we can actually map these tinnitus areas. It's a very specific MRI. They don't typically run this on patients, but we do know that white matter tracks change in your brain when you have tinnitus. So all of these things start happening all at once. Now, as you go through getting better with tinnitus, you're starting to use some sound therapy. Sound therapy is going to help your brain compare a safe, comfortable sound with a sound that it doesn't like, which is tinnitus, and go, okay, if I have 2 sounds, one I don't like and one I do, why am I not liking this sound, this other tinnitus sound? So it's going to make this comparison. It also kind of soothes the basal ganglia. It's going to soothe your amygdala. It's going to help kind of calm down all of those things that we talked about earlier, along with some cognitive behavioral therapy techniques where we're really addressing the emotions of the tinnitus that come along with it. That's going to change your brain into something more like this. So there is something called neuroplasticity. This is your brain's ability to change. It has changed with tinnitus, but it can change as we manage tinnitus. So this is another study that showed the difference in MRI with patients that started off with tinnitus. The big red area is in the temporal lobe, showing that tinnitus was pretty severe. As they went through treatment, doing sound therapy, cognitive behavior therapy, we could see that area start to shrink a little bit. And finally, the patient was saying that, I hear it, but it's not bothering me. We can still see it, but it's shrunk quite a bit. And so when those things start happening, that's going to turn on the parasympathetic nervous system, which is in charge of rest and digest. So this is the system that keeps you calm. This is the system that keeps you feeling at ease. And it is connected to the vagus nerve, which I wanted to mention because that vagus nerve connects your gut, your heart, and your brain. And that when all the other systems are on, this can get dysregulated, making you feel nauseous. So when the parasympathetic nervous system turns on, this guy can calm down and you'll feel much better. So as we start understanding how our brain works and understanding how our tinnitus is making our brain do these things, and learning steps and tricks and tips to regulate the tinnitus, we can turn these systems on and we can start changing our brain with neuroplasticity to get our tinnitus into a much more manageable area. So that's what I wanted to share with you. I hope that was helpful. And thank you for your time and your attention.
Thank you so much, Dr. Suzanne. Let's give a virtual round of applause. Perfect, perfect. Let's open it up to the first question. Suzanne, would you be able to briefly share your tinnitus journey, what you used to get better, a little bit of context for your personal story here?
So my story is that I had tinnitus in my 20s. That was from playing drums in a Scottish bagpipe band. Lots of noise exposure. I thought it was normal, didn't know what it was until graduate school when someone's like, oh, my teacher was like, that's tinnitus. That's what it is. And it wasn't bothering me very much. 6 years ago, I'm just going to give the shortened version, which is I had a head injury. I had a broken nose, dislocated jaw, concussion from a very traumatic event that happened. And when people were trying to come and help me, they were asking me, are you okay? Are you okay? And I couldn't hear them over the tinnitus. So it was very loud. It was very disruptive. I don't remember much from that. I remember waking up in the ICU and asking a nurse, why is there a generator and a tea kettle whistling? Because that's what I heard. And I could hear her. I could finally hear her. It was hard to hear her because it was still so loud. That, you know, there's no sound in here. It's really quiet in here. And I remember asking her, well, we need to change that. We need to get something in here. And so that's where it started. I really struggled with sleep. I really struggled with my mental health. I was very depressed, very anxious. And what I did was because I have worked with patients of tinnitus, I knew what I needed to do, which was I knew I needed to do sound therapy. I got devices that created sound for my ears. I knew I needed to see a therapist because I was having a lot of anxiousness. And I did talk to a psychiatrist to help me with medication. So I'm always very open and honest about the fact that I did some medication because I needed that to help me get through where I was because I was very, very anxious. So those are the things that I did, and it took a long time. There was moments where that default mode network was in high gear and telling me all sorts of stories. And as I had to really work on the cognitive behavioral therapy aspect to make sure that I was remembering my wins, remembering that things were changing, and just remembering that this is such a slow, slow process. But it is something completely, it is doable. But it took me about 18 months to get to a place where I was like, okay, now I'm feeling like I'm in a good place with my tinnitus. So it is a long journey, but I always like a big proponent of like, if I can do it, I think you can too. There's lots of different things that can be done. And I'm really going to encourage everyone to hang in there and maintain hope.
Thank you so much, Dr. Suzanne. So glad that you're helping tinnitus patients today and using the challenge in your life to really turn it around and make it really positive. We have a question from Nancy about your presentation. Nancy asks, the inner hair, the hair cell, does that ever heal itself? If if the hair cells are maybe getting worse or getting better, how does that impact tinnitus getting better?
Yeah. So some of the studies show that if it's just like a little mild change, like the hair cells can kind of get, I'm gonna say, mowed over a little bit. You can have like a temporary change in them and they can kind of stand back up. There's also a lot of redundancies in the system. So if some of them get damaged, others were going to start to pick up the slack. But as far as like full recovery of the hair cells at this point in time, there isn't anything. There is something that's on the horizon that I'm kind of keeping my eye on, which is there's a company that developed a microneedle to inject stem cells into the cochlea without damaging the cochlea and showed improvement in hearing loss of 45%. So that was in stage 1 clinical trials. They are now doing stage 2 clinical trials, and they are, and so I'm keeping my eye on that one. I think their stage 2 is going to also focus on tinnitus. So not yet, but keep your eye out for that.
Excellent. Well, we see comments that say, um, Jiva says, fantastic. There's comments saying very informative. Maria says, I learned more in this session than visits to my ear, nose, and throat ENT doctor. Well done, Dr. Suzanne. And just much more praise. So again, let's give a virtual round of applause and show our love to Suzanne May. Thank you so much. Suzanne, if anyone wants to work with one of the audiologists on your team at Treble Health, we're going to include a link in the chat where they can schedule a free consultation to see if they're a candidate. But in your own words, how can people get in touch with you or your team of audiologists that you run?
Yeah, I think if you go to our website, treblehealth.com, that there's a link right there. You can set up a free consultation where you can talk to one of the audiologists on our team about our program and about what we do to see if you're a right fit. That's probably the best way to start getting in touch with any one of our audiologists. I will say that we have an amazing team of audiologists who are all specializing in tinnitus and have years of experience. So I think Dr. Ben has collected probably the best of the best in the tinnitus world and put him here at Treble Health. So it's something that we're really proud of here. So
Thank you so much. And we're so happy. I'm personally so happy to feature the work that you're doing. And again, really appreciate all of the labor of love you put into your profession here at Treble Health, helping patients with tinnitus 24/7. But we also want you, Suzanne, to take care of yourself. So it's a combination of being all in, helping tinnitus patients, also recharging ourselves as health professionals so we can come back with the most energy possible. So with that in mind, thank you so much, Dr. Suzanne. We're going to transition into our next part of the presentation. We're going to have Mike here, who is a graduate, someone whose tinnitus got a lot better. I'm going to introduce Mike here in a moment. One of the key things about his story is that his original tinnitus on a scale of 1 to 100 was a 63 out of 100, so a serious problem. And the most recent time that we measured his tinnitus, it was down to a 20 out of 100, which is mild. So we're going to catch up with Mike, see what's going on with him these days, and he'll be able to share his story. Before I do that, I want to say a few words. So allow me to please share my screen here and give you guys an update from my side. Again, for those of you who are relatively new to Treble Health, my name is Dr. Ben Thompson. I'm an audiologist and tinnitus specialist. I live in California. I'm a co-founder here at Treble Health. So we are just all in. We have health clinics specializing in tinnitus in 3 states and more to come. We have a telehealth offering. We have seen over 2,500 patients over telehealth through a comprehensive treatment. And we also have a robust YouTube channel with educational videos. So this summit is to help our community. We know that some of you may decide to work with us in a professional context with our team of doctors, and we want to give that option to you all here today. But we know that some of you are going to simply get the information here and get benefit from it. This is the Tinnitus Relief Summit. We do this 4 times per year. This is the summer edition 2025. We just heard from Dr. Suzanne May about the ear and the brain. We're now going to meet with Mike and hear his patient success story for tinnitus. We have other talks coming up today, as you can see on the screen here. We're here for the next 2 hours plus, so stick with us or make sure to watch the recording as it will be on YouTube live as soon as right now. So with that in mind, a few quick words. We want to understand who is here. So I'm happy to say that there's over 200 people here on Zoom, and we have about 50 more live on YouTube. So for those of you who are here on Zoom, we want to get to know you and what kind of tinnitus you have, what you're going through, so we can help cater the information to you. So with that in mind, I'm going to launch a poll right now. It'll show up on your screen. It will say the Tinnitus Poll Summit Summer 2025. It will ask you about 15 questions. If you could go through this quickly in the next 2 to 3 minutes, that would be amazing. And then right after that, we're going to bring in Mike for him to share his story. As you guys are completing this poll, I'm just going to give some quick announcements regarding Treble Health. But as the pop-up appeared on your phone or your computer, please go ahead and submit the poll. And if you're here with us on YouTube, I'd like for you to comment in the chat of what exactly you're dealing with your tinnitus. Does it affect you during the day? Does it affect you at night? If you're on YouTube, on the live stream, let us know in the chat. If you're here on Zoom, where a lot of you are, then please go ahead and complete the poll. You have another 2 minutes to do so. Make sure you scroll down and complete all of the questions. So once again, the questions are, how bothersome is your tinnitus? How long have you been experiencing tinnitus? In what ways does it impact your life? How ready are you to treat your tinnitus? Do you currently have hearing aids? How old are you? What country do you live in? What's your zip code? How did you find Treble Health? How long have you known about us? Are you a current or former patient of Treble Health? Your name, email, phone number for contact information. And then do you live near one of the following cities? Those are the cities where we have a physical location, a clinic that you could come and have a free consultation or an appointment for. All right, let's give another minute here to finish your answers. I see we already have 15 answers completed. Thank you so much. And live in the chat on the YouTube live stream, I see Najia says it affects you 24/7. Bozo said he wishes tinnitus was only a problem with his hearing. We have some nice active chat in the YouTube live stream as well. All right, let's give another 30 seconds here to complete the poll. Thank you so much. Here on Zoom, there's over 250 of us, which is amazing. Now, I know most of you are sitting on your couch or driving in a car or in your kitchen, but imagine that we're all in a room. Imagine that we're all in an auditorium together. 250 people would be a lot. So this is actually a big online event, and we're really grateful that you're spending some time here with us. All right, another 10 seconds to complete the poll. So please go ahead and get your final answers submitted. And if you're on the YouTube live stream, I want to hear you say, what is your main problem you'd like to help us to help solve, or what do you need the most help with in regards to tinnitus? Is it sleep? Is it anxiety or stress? Is it your hearing? Is it concentration, like trying to work or study? Please let me know here in the chat. And shout out to Peter in the YouTube live stream. He says, greetings, Dr. Ben and the Treble Health team. The only treatment that works in a reasonable length of time, the Treble Health Tinnitus Treatment Program. So thank you, Peter. Nice to connect with you and see you here. All right, we're going to stop the poll right now. Thank you to the 47% of you who completed it in Zoom. Thank you guys so much. And if anyone would like to schedule a free consultation with Treble Health, on the screen right now, you can see a QR code. We're going to also drop that in the chat. This is a link where you can schedule a consultation with Treble Health. So this is a free telehealth consultation. We send you a Zoom link. You pick a time to speak with us as soon as today. We have one of our team members speak with you, understand what you're looking for, present some options. If we can potentially help you at Treble Health based on what you're going through and what you need, then we can schedule a consultation with a doctor on our team. That's a free consultation. So with that in mind, we're going to, again, put the schedule link in the chat, or if you're watching this on a laptop, you can scan the QR code on your phone right here in the chat. That is the link to schedule a free consultation. All right, thank you guys so much. We're going to take the QR code off the screen here in 5 seconds. All right, now for the fun part. Thank you guys for participating there. I'd like to introduce Mike. Mike, if you could turn on your video, that would be amazing. Very good. All right, as Mike gets his audio and video on, I'll give him an introduction.
It says it was disabled by you, Ben. I'm trying to, and it says you cannot start your video. It's been disabled by the host.
I'll change that right now. Thank you so much.
Okay.
All right, guys. Mike is a graduate, former patient at Treble Health. Mike is going to share his journey of improving tinnitus. He did participate in our program. That's how we got connected. He volunteered to do this. We asked him, and he said, I would love to share. His initial tinnitus functional index score on a scale of 1 to 100 was a 63 out of 100. His most recent score on that 1 to 100 scale that we measured was a 20 out of 100. So that suggests that his tinnitus improved more than 50%. Mike, that's exactly what we want to talk about today and hear what happened for you. We want to use this time to give hope, to give information and encouragement to others. So Mike, give us a quick introduction. What do you do for work? What's one hobby that you have?
Well, I have been in higher education most all of my life, both teaching and administration. At this point, I have transitioned, and I'm actually I'm pastoring a church in our area and doing some writing and other things I didn't have time to do when I was an educator for 30 years. So
excellent.
Yeah, and at this point, I guess with regard to a little bit of history about me, this struck me very strongly. It was December 22 that I had started to take some blood pressure medication. And I had done some blood pressure medication about 5 to 6 years before that, and it started with some light tinnitus, so I just stopped. But this time, blood pressure was more significant of an issue. So I kept taking the blood pressure medicine and kept going downhill until I had contacted you in your company somewhere around, I guess it was January, February. It got so bad that I decided I needed to do something.
Let me jump in here. I want to ask a series of rapid fire questions, okay?
Sure, yeah.
All right, very good. So when this first came on, how did it affect you? What parts of your life were affected the most?
How I can equate that, and I'll try to be quick. My first wife passed away when I was 40. As depressed and as dark a place as I was there, was comparable to the place that I was at when this tinnitus set in. I have never been, again, I didn't have to take medication when my first wife passed away. I had to take Klonopin, Trazodone. I was in the darkest place I can ever remember in my life. And part of the problem that you mentioned is people say, well, you know, I have tinnitus too. I got a little sound in my ears as if nothing's happening. It was a very dark place. Yeah, very dark.
So clearly a serious problem.
Yes.
One of the most serious problems you've had.
Ever,
yeah. What did it sound like? Ringing, hissing? What did it sound like?
Okay, and it was unilateral. It was only in my left side. It was more probably staticky, I guess, like yeah, just static and those types of things. No chirping, no anything like that. Just mainly staticky. It would change though. Sometimes it could get to a high pitch ring. You know, even to this day, it's just I've been habituated now. I mean, but I still have the sound. I just don't notice it as much. It'll change. It's very strange. It's been, yeah, it changes.
Okay. And then when you started working with us, talk to us about what tools did you use that eventually did help you get better? What were the tools or techniques that you did find relief or help with? Everyone here is looking for things they can put into action. So talk to us about what ended up working for you.
Sure. I think one of the big things just emotionally is to get connected. For me, Sarah Matthews was the audiologist I talked with. That was incredibly helpful to me to talk with her and for her to just tell me it's going to get better, because it was uncharted territory for me. I thought if this is the rest of my life, this is why I, you know, some people I have been in panels that about tinnitus, and some people feel like they felt like they should kill themselves. So just having somebody tell me that it'll probably get better was in itself important. But I think probably one of the most significant things was the masker, the Phonak masker that I got, the sound therapy. That really helped because it took my mind off of the ringing in my ears and put it on something else. And you would talk so highly about it. I watched a number of your videos, talked to Dr. Sarah about that. That was very helpful. And at night, that's where everybody says it gets worse, and it does. Sound machines, and I also got, which they don't make them anymore, but I got Bose sleep buds that I could put in my ears so that I could have continual noise. Now there's some other, I'm not promoting any products, but Anchor does have some that do the same thing. And that was incredibly helpful as well. I guess that'd be the three things I think. Both the emotional support, letting me know that there is hope on the other end of this, the sound therapy through the daytime, and then at night, I guess you'd call it sound therapy too, just the noise, something that I could hear that could take my mind off of it.
All right, so let's talk about those in a little more detail.
Sure.
In addition to the support by your audiologist who specializes in tinnitus on our team, Dr. Sarah, in addition to her giving the encouragement and the hope, did you also try any other techniques that were maybe more psychological or more cognitive? Anything that you want to share there?
You know, I listened to, and I haven't in so long, is it your 7-day or 8-day meditation that was out there. I listened to that. Meditation really did help me as well. And I forget, I've been on the other side of this for so long now. I forget you had somebody that you had recommended and you had interviewed at some point, and he had some things that were geared toward meditation. I listened to those as well. So meditation was a big part as well that I used, I guess, that helped me emotionally, psychologically.
Let's talk about that for a second, because when you get better, it's usually not just one thing. With our patients, we find it's usually a comprehensive approach. You're highlighting some tools that everyone here listening should take note of. Literally take a paper out and take notes. Because if you're not utilizing these tools, but you're having these thoughts of, I've tried everything, there's nothing I can do, but you haven't actually implemented these things well, you haven't done them according to a protocol or with a guided professional, then this is a clear, obvious next step for that thing that you can try. So, Mike, talk to us a little bit about each of those things. You said guided breathing and what sometimes is called meditation, guided breathing, that worked for you. Can you talk to us about what exactly you felt differently after implementing that?
You know what I remembered, and I played it multiple times. I don't know if it was session 4, whatever, on the guided breathing or whatever that you had mentioned. And you mentioned at one point, okay, listen to your tinnitus and kind of talk to your tinnitus, and you know that was really helpful to me because I addressed the tinnitus because typically I was so afraid of addressing the tinnitus, but I actually began to think about it and focus on it. We spend all our time not focusing. And I just remembered in the context of quiet meditation to do that kind of made it like the Wizard of Oz experience. There's somebody behind the curtain that you're afraid to look at, but when you see it, it's not as bad. So that helped me. I listened to that one a number of times, and again, I think for me, why it helped is because I could hear it in the context of quiet and peace, and I had been used to meditation in other contexts before, so something I was used to, but not in this context with tinnitus. So,
Okay, thank you so much. And then the devices, sound therapy devices on the ears. How did that work for someone who has not tried that?
Yeah.
What exactly does that entail?
Yes. Oh, okay. So, and I could tell you, I mean, it was not immediate, like within a day or two, but it was pretty quick within a week or two. It really de-escalated my anxiety to where I was still anxious. I was still having to do Klonopin, but Dr. Matthews, Dr. Sarah, she helped me adjust it to right where it needed to be and the certain sound it needed to be. And you can explain it better than I, but I think it trained my brain not to listen to the tinnitus, but to hear this other sound. And so the tinnitus just became a non-threatening noise that simply over time I became habituated to. And so, yeah, that was incredibly, all the other things were helpful, but that was equally as important as anything that I did, that the sound therapy with the device, yes.
Okay. If anyone listening wants to try that, you can reach out to us at Treble Health. We can help you with that, direct you towards next steps, as well as the guided breathing. I actually posted live in the YouTube stream as well as here on Zoom, a link to that day 1 of the 7-day tinnitus meditation challenge. That meditation challenge is free. The sound therapy devices are they do have a cost associated with them.
And can I mention, I want to go back to that since you asked. I think everybody knows this. I am not getting paid to do this. I'm not trying to promote anything. I can just tell you, I'm a very skeptical person of people. When I found you and the people there, I was incredibly happy. And the masker itself, I'm not trying to sell anything. It wouldn't have been the same without that sound therapy through the daytime. I believe I would have been in that depressed place for months longer than I was. That is probably the one single piece. I needed Dr. Matthews to explain all these things and to correlate, but without that, I think these other things wouldn't have made nearly as much difference. I would have been in that place a lot longer.
Let's talk. Thank you so much. And let's talk about your success or your treatment. People are hearing your story and they might be skeptical themselves. They might be saying, Mike, do you still have tinnitus? Is it actually softer, quieter? What actually happened? So talk to us about that.
I'm a mystery. I was just at the doctor last week and I've got some other issues. And he says, Mike, it's a mystery. I don't know what's going on. So my tinnitus was probably about the same as the other medical issues that I have. It would get loud, it would get soft. There were actually some times where I couldn't hear it, where it was quiet. This last week, it's becoming louder again. It just doesn't disrupt me. I might think about it once or twice a day because it comes back. Not doesn't come back. It's always there. It's just for some reason it requires my attention. But I don't have to put the masker back in or have to do anything. I just get focused on something else and it becomes, in essence, white noise. So I know that early on, the idea that maybe the tinnitus would actually get lower in volume. I suppose it is sometimes still. It just fluctuates. Sometimes, occasionally, it's very, very low. And sometimes it's loud, not obnoxiously loud. I don't know that it's like significantly different. My mind has habituated to it to where it's just some noise back there that I don't really worry about at this point. It took a while to get to that place, but yeah, I'm to that place now. It really doesn't impact my life in any significant way at all for the last number of months.
Oh, I'm really happy to hear that.
Yeah.
And when we first spoke with you on our team, we had you fill out a comprehensive questionnaire, and
Yes.
the areas that were the most impacted were, in your specific case, were sleep, emotional distress, sense of control, and relaxation.
Yeah.
So how did those change over the course of getting better?
Everything got better. I mean, it's night and day. Yeah, I would say my anxiety level again. I had to go. I'd never been on medication for anxiety or anything. I'm just not an anxious person typically, and that went away fairly soon. Took a little while, and being able to function and to work, I was that as well. Was a little quicker. Sleep, that took a little longer because I guess, it's quiet when you sleep. And even with the earbuds in and everything else, it took a little longer. And I was on medication a little bit, some trazodone to help sleep. But that eventually got better. Again, it's been probably it was February of 23, it was probably, I'd say 6 to 8 months. And I was pretty much in those areas headed in the right direction. I would still say on the stage issue, I was probably stage 3 at that point. It took me a while to get beyond that. But yeah, all those areas now, I mean, my life is pretty much normal. If you saw me, I wouldn't draw attention to my tinnitus at all at this point.
Wow. So the theme of the summit here is long-lasting relief from tinnitus is possible. We're not here to say it will happen for every single person. That's not the case.
Yeah.
It does have, however, for a majority of patients that go through the right kind of program, they do get there. So it sounds to me like you have this long-lasting relief where it's just not a part of your life much anymore.
No, I hear it once in a while, but I mean, I have friends that have tinnitus, and then when I was going through this with them, they say, "Oh, Mike, when we talk," I had a counselor who's a good friend of mine. I just meet with once a week in a group that we talk, and he says, when you mention that to me, I start thinking about mine, but then then it goes away. And I suppose it's like that for me at this point. If somebody said, "Hey, is your tinnitus actually? Can you hear it right now?" If I listen. So like right now, I guess I can hear something, but it's nearly mute. At some periods of time, however, just in case people are going there, if it gets a little louder at times, I would think, oh no, it's never going to get quiet again. It's up and down for me, but at this point, even when it gets louder, it doesn't impact my life that much. I can get my mind focused on something else without having to use a mask or anything else. And so pretty much my life again is I'm so thankful back to pretty much normal. Yeah.
Well, it's worth highlighting a few things. Number one, people who are listening should not expect the exact same path as you've gone.
Yes.
Tinnitus, the reason why many doctors don't know what to do with tinnitus is because it's not a cookie cutter treatment or condition. It needs to be personalized for the things you do, when you do them, and what type of treatment you undertake. So I just wanted to add a disclaimer. Anyone listening, we can use Mike's case as hope and encouragement, but don't fixate on how long it took him. His tinnitus fluctuates and it's in one ear. A lot of people have constant ringing in both ears that doesn't fluctuate. So just want to highlight that. Mike, we have some questions coming in. We'll get to those in a moment, but generally speaking, what is your advice for people? Let's look at people who have had bothersome tinnitus for at least a few months. They've tried a few things, whether with doctors or on their own, but they're looking for more. They don't want to live with the intensity they're currently having in their ears. What's your advice for that kind of person? What did you learn on your journey?
Again, it's going to sound like a commercial. Best thing I did was contact Treble Health. That is, I do not know what would have happened. I suppose over time, maybe years, I don't know, maybe it would have gone away. But that's the number one thing I did that was helpful, was contacting Treble Health and being able to talk to people who, which it's very interesting to me because I know that Dr. Mayhew just spoke, Dr. Matthews both had tinnitus. So you're talking to people that this isn't a theory. I've been in education all my life, have multiple graduate degrees. So I know the knowledge and the mind about things. You need something where somebody's walked the path that you've walked that just don't have some type of esoteric knowledge. So that's one of the things I really appreciated. And following what they did, because I would get kind of frustrated too, because there are these testimonies about period after a couple, 3 months, some people who are feeling like, wow, life is getting back to normal. And I was going 6, 8 months and I was better. I was certainly better, but it wasn't normal. And there were questions, my wife and I mean, would we ever be able to go on vacation? Could I enjoy life again with our grandkids and those types of things? So I think just sticking with it and doing what I got into a series again with Dr. Matthews, a series of appointments. And that was incredibly helpful because we could check in and we could just talk about what's happening. And she could reassure me, again, like you just did, there's no specific thing that's going to happen. There's not a pattern, but yeah, you're making some headway in this and that and the other. And that's kind of what I needed. So I'd say that's probably the most helpful thing for me, was just sticking with what she was telling me and doing the things that she suggested.
Thank you so much. Mike, we have our first question. It's about sleep. How was your sleep affected by tinnitus, and what tools helped your sleep?
Sleep was bad, really bad. I mean, I would try to go to sleep. I had to sleep in a different room than my wife at that point. It was because it was too disruptive. She didn't care. She would have done whatever she could do. I just didn't want to disrupt her. But maybe an hour, and then it would wake up, and I'd be up for I don't know how long with the noise. And even with sound machines, it was difficult to get it. The one thing that helped me with that, though, was I remember you saying at night, just turn it up loud. It doesn't matter whether you hear your tinnitus or not, because I know with a masker, you're still trying to hear it. And so that did help, but it just took time. I did take some medication. I don't like to take medication, but I did take some that the doctor prescribed because I just had to get some sleep. But it was a struggle. It was a struggle for some time, probably for a few months at least. And but now it just doesn't bother me much at all. I can hear it at night sometimes when I get up, go to the bathroom or something. I'll come back and I'll hear it. But I still have my sound machine. I play that all the time anyway, and so I'm able to get right back to sleep. I still just go back to sleep, even though I can hear it sometimes. But so it's not impacting my sleep really now at all, I would say.
Thank you so much. And then some other questions on, did you find the cause or the root cause of your tinnitus? Any advice for people kind of stuck on that part of it?
Yeah, and that was the thing, that there was also suggestion to track everything you eat, everything you do. I followed that for a little while, and that was not helpful to me. That's like going down a rabbit hole that just makes you focus on it all the time. They never did figure out, and I still to this day can't figure out on the day when my tinnitus is louder, what is it that caused it? I don't think as much about it because it doesn't bother me as much, but I do think back, and there's nothing I ate, nothing I did that seems to trigger it. For me, I am convinced that it was the blood pressure medicine, although the doctor couldn't believe that. But I know because, again, the very first time I took blood pressure medicine, that's the onset of it initially. I stopped quick enough, so it was very mild at that point and just sporadic. But when I started taking it again and then stayed on it, so that's what brought it on. I know for me, I don't know why. I don't understand all the ramifications of that, and the doctor couldn't explain it. My cardiologist, fortunately, he just said, you can just go off it if you'll do some certain things about your diet to keep your blood pressure low. We'll do it that way. And unfortunately, I'd been too long taking the blood pressure medicine. So, but that's what did it. I'm convinced. I just don't know why it did it.
Mike, you've been a joy. Let's give a virtual round of applause to Mike here. We'll throw some thumbs up. We'll throw some hearts on the screen. Thank you so much. You've really shown us that, hey, even though when this tinnitus is not solved by other doctors, it fluctuates, seems to have a mind of its own. You're really struggling with it. you're losing sleep, you found a professional, in your case, us, you found a professional that could help you, you followed a protocol, you did get better. So this is really important. And if this helps at least one person listening, which I'm sure it helps hundreds, then I hope it's worth your time. So thank you so much for being here.
I just want to say one final thing because
Get
I
the final
know
word, Mike. It's all yours.
Yeah, that's it. I felt hopeless. I honestly felt hopeless, like nothing would work. And I know there's people that feel that way. I got to tell you, there is hope. There, you just have to hang on to that. There's hope. So I just want to mention that because that's what I needed then, and I know that's what a lot of people need.
Absolutely. And we need that reminder constantly through the journey. So thank you, Mike. Hope to meet you in person one day. You've been enjoyed. Have a great rest.
Thanks for all that you've done. I appreciate it greatly. Thank you.
You are so welcome. I love it. This is why Treble Health exists, to share these stories and to help patients through their journey. So thank you guys so much. That was Mike. We are now 2 out of 6 sessions completed for the Tinnitus Relief Summit. Next up, we have Dr. Priscilla Aguilera talking about hearing loss, tinnitus, hearing health, some cognitive health. We're excited to get into this. I'll be having the conversation here with Dr. Priscilla, who is our audiologist in San Francisco, California. And she works at our San Francisco clinic for Treble Health. So excited to bring her on here in a moment. I wanted to mention, if Mike's story inspired you and you say, you know what, I would like to talk to a specialist, maybe Treble Health can help me, we have an option for you guys to work with us. It's completely optional, but we want to make sure everyone here knows there is a way to get help, and help does exist. So that's why we have it on the screen right now. We also include it in the chat on Zoom, as well as YouTube in the live stream comments. So you guys are awesome. Let's keep it up. If you want to scan this QR code or look at the link in the chat, you are welcome to do so. Now I'd like to introduce Dr. Priscilla Aguilera. So Dr. Priscilla, if you'd like to turn on your video, now is a great time, and I will provide an introduction. All right. Dr. Priscilla, how are you today?
I'm doing well, thank you.
Amazing. All right, guys, this is Dr. Priscilla Aguilera. She will discuss the topic of hearing, hearing health, hearing loss, and tinnitus, understanding the link between the hearing of the ears, what did the hearing test show, and tinnitus, the ringing or hissing in the auditory brain. What do we need to know about that? She'll also discuss treatment strategies for people with tinnitus and hearing loss. She is a doctor of audiology with over 15 years of experience. She trained at UCSF Medical Center and worked there for 8 years. That's a major hospital, top 10 hospital in the country, based out of San Francisco. That's where her and I met, where I was a resident and she was an audiologist. And so she brings her personal experience because she herself has hearing loss and tinnitus in one ear. So she's an advocate, and she's an excellent team member of ours at Treble Health. So welcome, Dr. Priscilla. Let's give a virtual round of applause here. We have a series of questions that we think are going to be very helpful for our patients. And I'd like to start with question number 1, which is, how does hearing loss contribute to the onset and outlook of tinnitus?
Yeah, thank you. Thanks for having me. So hearing loss means that the brain is actually getting less sound, okay? The brain actually doesn't like to have less sound. And so it can actually change the way that it behaves. It can rewire itself. We call this neuroplasticity. And so when there is a lack of sound reaching the brain, or reduced sound getting there, so there is this internal volume dial of sorts that will increase its sensitivity, right? So increases its sensitivity to try to say, I don't hear certain sounds, or I'm not getting a lot of information, so I must turn up my internal volume button to see if I can hear a little better. But one side effect of that is that sometimes then the brain actually perceives its own internal noise, like its own kind of baseline neural activity, and that can be perceived as tinnitus, hissing, ringing.
Thank you. So what have you seen over your years helping tinnitus patients with hearing loss? How many patients with a tinnitus problem actually have a hearing loss that shows up on testing, and what kind of testing is typically recommended to find that?
Sure, yeah. So not everybody who has hearing loss has tinnitus, and not everybody who has tinnitus actually shows a hearing loss on a standard audiogram. So the hearing mechanism is super complex, as you probably learned earlier from Dr. Suzanne's presentation. Super complex, and there is such a thing as what we call hidden hearing loss, which basically means that it's not showing up on an exam, but somewhere along the pathway from the organ of hearing up to the brain, there it could be a small damage or a lack of function in a certain part. So one of them is called, hidden hearing loss, and it has to do with the way the inner hair cells of the cochlea of their organ of hearing have less kind of activity, or they don't are not sending a correct signal in between that and the nerve, the auditory nerve. So it's a small little connection or synapse between our organ of hearing and the hearing nerve that can show up in other tests. One of them, for instance, is the auditory brainstem response test, which is actually measuring brain activity related to sound. And you can also, the standard hearing test, it also doesn't measure necessarily what the hair cells, the outer hair cells in particular, that amplify sound, are actually doing in the organ of hearing. So there's a test called the distortion product otoacoustic emission that actually tests the function of those hair cells. And that can actually sometimes show us, oh, okay, there's decreased hair cell function, but you can still have normal hearing. And the reason for that is that we have thousands of hair cells in the inner ear. And so for it to show up as hearing loss, you would have substantial damage to those auditory hair cells. So the other thing that can be done if the hearing test is showing normal hearing for the frequencies of speech, which are between 250 and 8,000 hertz, ultra high frequency testing. So these are testing kind of the extended range of hearing. Human hearing is between 20 to 20,000 hertz. A standard test will only look at 250 to 8,000 because that's what's important for speech understanding. But ultra high frequency testing tests beyond that, up to 20K hertz, and that can show us sometimes some hearing loss there. So yes, you can still have tinnitus and have a normal standard hearing exam.
Thank you. Thank you. Yeah, a majority of patients with tinnitus do have hearing loss. Those of you who are here, I'd like to hear in the chat, did your hearing test, number one, have you gotten a hearing test? And if so, did it show that there was some hearing loss? It's very common, usually 80% of cases we work with, where there's some change to the hearing system. Patients can still have primarily a tinnitus problem. They don't perceive a hearing problem, but the hearing test shows, oh, the hearing isn't what it used to be 30 years ago. And that's an important point for everyone here to know, because we might overlook that fact that, oh, the ears are not what they used to be. And then what you were just saying, Dr. Priscilla, is that when the ears are not what they used to be, the auditory brain can essentially create this phantom sound. The sounds that the ear does not process through, soft, high-pitched sounds, are then perceived in the brain as high-pitched hissing or ringing that the patient hears in soft, quiet environments. So very much one-to-one relationship for some patients. So when tinnitus persists or is actually bothersome, what have you found with your patients about how to break the cycle with tinnitus and an associated hearing loss?
Yeah, so one of the first kind of things that you want to do is, if there is measurable hearing loss and you have tinnitus, restoring that auditory input, or basically giving back the brain some sound. And you do this with hearing aids that will help the brain kind of turn down that internal volume button a bit. And so it reduces its sensitivity. And when it does so, right, you're also simultaneously stimulating the brain with sound. And so that can make the tinnitus perception a lot less than without devices. So one of the first kind of lines of treatment is, if you have hearing loss and you have tinnitus, hearing devices will help the majority of people reduce the perception of tinnitus.
Okay. Wow, that's big news. what exactly would that experience be like for a patient, and who is the right person to try that? And maybe, when is it not the right idea for that tinnitus and hearing loss? When should someone try hearing aids?
Yeah, absolutely. So you should definitely try hearing aids if there is hearing loss. And the right person to do that is an audiologist. So you want to see an audiologist. And if you have bothersome tinnitus, you specifically want to see an audiologist who specializes in tinnitus. So aside from just, returning sound to the brain via amplified sound, right, which is what a hearing aid does, it allows you to hear the sounds where there's a deficit. Um, you can additionally add in what's called sound therapy. So a lot of today's hearing aids can be set up as a hearing aid only, or they can be set up as a combination hearing aid and sound therapy. Um, Oftentimes with tinnitus, there could be some sound sensitivity. And so if you are experiencing some sound sensitivity, when you're fit with devices, then, we may want to consider shifting focus more to making sure that the sound is comfortable so that we're not giving your brain too much input now, and then, making that tinnitus seem a little bit more noticeable, because you can have too much stimulation going in the brain too.
Okay. All right. Well, let's talk about two groups of people. One, a group of people who have never tried hearing devices for their tinnitus treatment, but they have tinnitus and they have hearing loss, even a little bit of hearing loss. Let's talk about that group, people who have never tried it. What could they expect in the first few weeks? And then I have a second group I want to ask you about.
Sure. So what you can expect if you have just a little bit of hearing loss, I have never tried devices before, is that there should be, just because you're giving the brain just a little bit of sound, there should be, on the short term, just some quick relief from the tinnitus. So majority of patients that I worked with, even before, specializing in tinnitus, that had some degree of maybe mild hearing loss and tinnitus, actually didn't hear the tinnitus any longer once they started wearing amplification. Again, we're giving the brain some sound, and by doing so, you actually can tell the brain to kind of reduce its internal volume system.
Thank you. And then what about the second group of patients who they have already tried hearing aids? I think it's common for patients to say, "Oh, I went to a hearing aid shop. I tried hearing aids. They didn't really do that much." What would you do for that patient, someone who tried something before? Tell us about how you would approach that case, either by adjusting the hearing aids or maybe trying something else. Yeah.
Yeah, absolutely. Good question. So I think first thing is just, okay, tell me about your hearing experience. What worked, what didn't work? I actually encounter this quite often where people have tried hearing aids and they will report it makes everything really loud and it's too much, right? It's too loud and it doesn't help my tinnitus. So with that particular patient, if we're able to look at the settings, we want to see, okay, where are they set at? Maybe we want to even reduce a bit of the amplification, just take it down a notch, right? We're maybe giving too much input to the brain. And we want to also see if there's any sound therapy that we can add in. So we can set the devices, we can reduce volume of the microphones, with the environmental microphones or hearing aid part. We can add in sound therapy. We can do a combination of both. So I think for this population that has had an experience with hearing aids, I think it's worthwhile to try again and to have someone who understands tinnitus work with you to get those settings just right for you.
Completely agree. And that can actually be the same devices that they already own. They can be adjusted in many cases. But in some cases, specific hearing aids have limitations that actually aren't a great product for tinnitus treatment. Great points. Totally agree with you there. When we actually put the device on the ear, can you talk to us about the piece that goes in the ear canal and what that means for a tinnitus patient? Some people might think, "Oh, I don't want to plug my ears all day." with a hearing aid. Talk to us about that.
Right. So when we're fitting specifically for sound therapy purposes, and if you have mild hearing loss, and most people tend to have hearing loss in the high frequencies and have really normal low frequencies. So we don't want to really plug up the ears, as you said. We don't want to stick anything in there that is going to block out the natural sound, right? If we do that, then it's like putting an earplug in the ear. So the actual piece at the end, it's like a little silicone piece. It's usually round. Actually does allow for natural hearing or natural sounds in the lower frequency range to come in. And so when you put them on, your own voice will sound just as it did prior, right? It shouldn't really change the quality of your voice. You'll be able to hear, the environment around you. And we can add in sound therapy as well. So the part at the end piece, it's somewhat important. It's actually really important because we don't really necessarily want to occlude or block that ear canal.
Thank you so much. Can you share briefly about what going to a tinnitus clinic experience is like? So you're currently at home, you're in one of your work from home days, but you also have working at the tinnitus clinic in San Francisco with Treble Health. What should a patient, what could they expect in terms of going to see a tinnitus specific appointment compared to maybe other doctor appointments they've already had regarding their tinnitus? Yeah.
Sure. Yeah. Are we talking about either virtual or in person?
In the clinic specifically.
In the clinic, yeah. So, I mean, first of all, we welcome you. So come see us in San Francisco clinic. We'll have, opportunity to talk about, your specific case, the onset of your tinnitus, the quality of it. Oftentimes we will complete a hearing exam. We will complete high frequency audiometry if that hasn't been done, or if particularly if your hearing exam shows normal hearing. We set up a treatment plan. Basically, we would most likely recommend wearing ear level sound therapy devices. Again, these are going to go over the ear open, so they're not going to block the ear canal or block any sound. But by having them ear level, you get direct input to the brain. But so when you come to see a tinnitus specialist, we're going to be spending time, as I mentioned, going over a case history. We're going to be measuring hearing, maybe doing some of these other tests that aren't typically completed in a standard hearing exam appointment. We'll recommend sound therapy devices. We'll provide you with tools and techniques and coaching to help you lessen the reaction to the tinnitus.
Thank you so much. Guys, I want to add something that hearing and tinnitus, for many people, just getting tinnitus treatment and reducing it is enough of a motivation. But there's important research that has come out in the last 5 years that everyone with hearing loss should know, which is the relationship between hearing loss and cognitive decline. There's a study called the ACHIEVE study, and it was published in 2023. It was a large NIH-funded, National Institutes of Health funded study, which was a randomized control trial that found that wearing hearing aids for people with hearing loss for older adults at risk for dementia reduced the rate of cognitive decline by 48% over 3 years in those with higher dementia risk. So again, older adults who had hearing loss, who were at some risk for dementia, getting hearing aid treatment for their hearing loss reduced the rate of cognitive decline by 48% over 3 years in those with some serious dementia risk. Now, that brings up a lot of questions. Number one, do I have hearing loss? Number two, am I at risk for dementia? And number three, have I seriously considered hearing treatment? This study showed that the mechanisms for how this works are that when you hear people more clearly, that's treating your hearing loss. It reduces the cognitive load. The brain doesn't have to work as hard to decode sound. It promotes better social engagement and keeps your neural networks active. and it possibly reduces depression or social isolation, which are both dementia risk factors. So that has a lot of implications. And then when you layer on tinnitus and the effects that tinnitus has on stress, anxiety, and sleep, then it really supports that to have the best hearing health, to have the best brain health, we should look at treating hearing loss. And that's actually been shown as being one of the top modifiable risk factors for cognitive decline. So it's not fun to talk about that, but it's important. So that's why I wanted to bring it up. Dr. Priscilla, I want to ask the last question, then we'll open it up for the Q&A. So if you have a question, please type it in the chat or mention it in the Q&A section. So how would you counsel or educate patients who might be hesitant to try hearing treatment?
Yeah, absolutely. I think for all those reasons you just mentioned, right, that hearing is the number one modifiable risk for dementia. And, sometimes people don't realize how much we're missing with when they have hearing loss and how much easier things can be. And, there's still some stigma, and I hear it all the time from patients that, I don't want to wear them at work because I'll look old, or I don't want to admit that I have hearing loss. But oftentimes, I think what's more noticeable is when that person is not, communicating as easily. As actually kind of interesting, having worked with patients with hearing loss for a really long time. And often people will come in because the family members are getting to a point of like, get a hearing aid, go get a hearing test, you can't hear. And so patients come in and say, well, I'm here because my partner told me to come here, my children tell me to come here, and they keep pointing out, what I'm missing. And the funny thing is that after they get fit with devices, if that's the step they want to take, and we support that, oftentimes they'll come back and say, nobody's noticed that I'm wearing devices. And I think that, somewhat speaks to, I think as, humans, we kind of sometimes focus on the things that are not correctly, but which would be, oh my gosh, like this person can't hear me. I always have to repeat myself. But once they start wearing hearing aids, they are not noticing, I guess, the effects of the hearing loss because now they're wearing devices and they can hear and communicate much more easily. So for all those reasons you mentioned, reduce cognitive load, that hearing loss being the number one modifiable risk for dementia, I would, definitely recommend and support people to consider devices.
Yep.
You never know what you're missing.
Thank you. I agree. And there's risk-free trials for this with audiology specialists, with Treble Health. You can actually try these before fully committing to them. All right, we're going to open it up to Q&A. I got some good questions. First, people want to learn about your hearing and your tinnitus. Can you explain what and why you have that?
Sure. So my journey as an audiologist, actually, unbeknownst to me at the time, started when I was 16. I actually had a sudden hearing loss. So I woke up one day with hearing loss and tinnitus, very loud tinnitus. And, I went to the hospital. I was sent home with anti-nausea medication. Months later, I didn't see an audiologist or ear, nose, throat doctor. I didn't even know that existed. I kept kind of being, I went from one medical provider to another one, trying to figure out what was going on. Because I had tinnitus, I didn't actually perceive that I had hearing loss necessarily because I was hearing something, right? But at this point in my life, I have no idea what that is. So long story short, once I went to college, they had a hearing and speech department. I would always walk, wondering, oh, what do they do there? I'm really curious about it. One day I had the opportunity to go in. I talked to one of the professors. The next, I think, semester, I signed up for a physics of sound or acoustics class, and then the rest was history. And that was a journey that I took because I didn't understand, the implications of my hearing loss just from a day-to-day communication. I hear really well and quiet, but noisy environments are really challenging for me. And I also didn't understand the tinnitus and that sound that I was hearing. I was scared. So my journey was actually becoming an audiologist. That was kind of the long roundabout way to get to a place where, you know, I have full acceptance of both my hearing loss and my tinnitus. I hear my tinnitus if I think about it, which these days is often, but curiously enough, even working with tinnitus patients daily, it's still not bothersome to me. I can, you know, bring it to attention, but I can easily forget about it as well.
Well, thank you so much. So glad that you're working at Treble Health and helping patients based on what happened to you. And yeah, sudden hearing loss, we see it a lot with our patients too, right? So that's one of the causes of tinnitus. Okay, we have a question of Jack asks, is it wise to wear earplugs in loud environments?
Excellent question. So yes, and when we talk about loud environments, we're thinking a couple of things. We're thinking like, what's the volume or decibel level of that environment? So anytime it starts to get above like 85, 90 and above, you want to consider using hearing protection. So if you're, you know, going to a concert, going to like a loud party with large speakers, yes, so that absolutely you want to be protective of your hearing in those environments. So, you know, you want to look at, you know, how loud it is, decibel, how long you're going to be exposed to that, and how close or distance you are to the sound source. And hearing protection can help reduce.
Thank you. And last question from Tim here live on the Tinnitus Relief Summit, Summer Edition. Tim asks, do you think hearing aids generally help tinnitus? And does a hearing aid stop hearing loss or does it slow down hearing loss? How does that work?
Yeah, good. I like that question. So yes, absolutely. Hearing aids can help manage again, the perception or awareness of the tinnitus. You know, tinnitus can appear, again, going back to, you know, this internal volume setting, the brain increases its sensitivity because of the lack of sound. By restoring the sound with hearing aids, you're actually reducing that brain sensitivity, and that can help kind of lessen the perception of tinnitus. Plus, you're also creating a contrast between quiet and sound, right? So you're giving your brain sound, there's contrast, you're not just in complete silence because you're getting a lot of auditory input. The second part of the question.
Second part of the question was, do hearing aids stop
slow down
loss or slow down?
Yeah, good question. So hearing aids can help slow down what we call auditory deprivations, or when there's a lack of input to the brain, right? So it can help. It does not necessarily change your results that you see on a hearing exam, but oftentimes as audiologists, we also look at something called the word recognition score, and it gives us basically an idea of what you can hear and understand if we can make the volume loud enough for the person to hear. So oftentimes with untreated hearing loss, we can see a really poor word recognition score. And so hearing aids can slow down that deterioration or that deprivation of sound. So it doesn't necessarily increase your hearing or make it better, but it definitely slows down. And as we, you know, learned today by what Dr. Ben was mentioning about the Achieve study, it can help reduce early cognitive decline symptoms.
Thank you so much. Well, guys, let's give a virtual round of applause to Dr. Priscilla Aguilera out of our San Francisco clinic. If you're in the Bay Area or Northern California, definitely come and schedule an appointment. We'd love to see you there. We created the clinic for you, so please come. And if you want to work with Dr. Priscilla or another one of the audiologists on our team, we have an option for you to do that by scheduling a telehealth appointment. We've seen over 2,500 patients virtually via telehealth through a comprehensive treatment. So you don't have to find someone in your local area. Instead, you could use the internet and technology to actually solve your tinnitus. Dr. Priscilla, I'll give you the last word here. Again, thank you so much for your great knowledge.
Thank you so much. Thanks for having me. Come see us.
Lovely. Thank you so much. All right, guys, we're going, let me put on the screen for one moment a review of today's schedule. So if you were here from the beginning, let's give yourself a shout out. But you know, we are Treble Health. So We want to focus on your health and well-being. If you've been watching an hour and a half of this webinar, but you have not stood up to stretch, walk around, if you have not drank some water, let's go ahead and welcome that in right now. We're not stopping, we're keeping going, and thank you all for being here. Next up, we have Dr. Tricia Scaglione talking about tinnitus treatment. What does success look like? If you would like to speak with a specialist at Treble Health, we have a way for you to do that right now. You can scan the QR code and you can have a free consultation with a team member at Treble Health. So this is a way for us to meet with you and understand what are you going through, what help do you need, and offer some solutions. If working with Treble Health is something that you're interested in, we can explain the details, the cost, and the expectations for that as well. We will also put the link for the free consultation here in the chat. So thank you guys so much. We're going to now jump to our presentation. Tinnitus treatment, what does success look like? We're joined by Dr. Tricia Scaglione. Tricia, how are you today? Coming live from our Weston, Florida location.
I'm good, thanks. Thanks for having me as part of the summit. I'm excited to see everybody online joining us today.
You've got it. So guys, South Florida now has a Treble Health clinic. Dr. Tricia is going to present today on tinnitus treatment. What does success look like? Defining and measuring meaningful results, setting the right expectations. How long should it take? How much better can I get? Is it just habituation or will the volume go down? These are the right kinds of questions that so many of you have, and we're going to be discussing them today. Dr. Tricia is an audiologist with 15 years experience, formerly the director of tinnitus and the sound sensitivity program at the University of Miami Health System. That's how I got connected with her, because I knew she was doing great work there in South Florida. She holds a Doctor of Audiology degree and an MBA, Master's in Business Management. She's active in national tinnitus guideline development and advisory committees, including the American Tinnitus Association Science Committee. And she's been published in various textbooks and is also an international speaker. So Dr. Tricia, welcome to the Tinnitus Relief Summit. I'd like to first open it up by allowing you to give a little background of your experience and the unique perspectives you bring as a tinnitus specialist.
Sure. Thanks so much, Ben. So my experience, I've been working with tinnitus patients for 15 plus years. I come from a very large academic medical center where I did the majority of my practice. And I'm very fortunate to now be able to bring it to Treble Health and see tinnitus patients every day. Because, as you can see by the number of patients that are logged on to this today, there's so many people across our country, and even those that are watching internationally, that are looking for support. And my background also includes mind-body medicine training. So this essentially is looking at, we're not just looking at the symptom of tinnitus, but we're looking at the whole patient, and also incorporating, how we manage everything about the whole patient to have the greatest success with managing our tinnitus.
Thank you so much.
Sure.
Let's open it up with understanding how you define treatment success. What exactly is getting better with tinnitus? How does someone know if they are getting better? Let's open it up with your perspectives on that, please.
Sure. That's a really great question, and a question I think we get asked in the clinic quite frequently, especially from patients that are just starting with a tinnitus management journey. Everybody kind of wants that magic pill, and they want to know what's the outcome going to be. So, regardless of the tinnitus treatment that you do, full disclosure, there's not a magic pill. Success looks, I want to be very clear that success does not mean that we're going to eliminate the tinnitus. Right now, there's no proven device or evidence to completely make the tinnitus completely eliminated, but I don't want that to discourage you. Just the opposite. That success can be, we can definitely achieve success in tinnitus patients. And what that means is we are going to train your brain to habituate or get used to the tinnitus. So even if we can't eliminate it, we can give you back quality of life. We can help to reduce that. For those of you in the chat that are writing about just how bothersome your tinnitus is, how consuming it is, we hear you. We see patients just like you every day, and success means we are able to get you back to doing the things that your tinnitus is prohibiting you from, whether that be sleep or being able to concentrate, being able to focus at work. Maybe it's impacting your relationships. Maybe you're not able to socialize because of it. I'm not sure if I just mentioned sleep, but sleep is a huge one for our tinnitus patients. So success is getting you back to being able to do these things and taking your tinnitus from being very bothersome and being like right here in front of you to putting it in the back of your brain where you're not that focused on it. Much like if you hear the air conditioner running in your house, you might hear it, but it doesn't disturb you. And it's really interesting because when we're measuring success, it can be through a couple of different modalities. One of the key ways is being able to identify first, how is tinnitus bothering you specifically, so we can make an individualized care plan. And then the goal is to track how those particular areas are improving for you. There was a study that was conducted a couple of years ago and published that looked at the expectations of tinnitus outcomes and looking at, what is success from the perception of a patient and from the perception of an audiologist. And the study found that more audiologists are looking at how the reaction to the tinnitus sound changes. That determines success, meaning we're reducing your awareness to tinnitus. We're reducing that disturbance. We're increasing your ability to sleep. We're increasing your ability to function in your daily activities. We're reducing your stress and anxiety. While patients determine success of, is my tinnitus softer, or is it significantly different than when it was at the beginning? Besides just talking and hearing the subjective feedback from our patients, we also do conduct assessments using validated questionnaires. So if you've been through Treble Health already, you know that at the very beginning, we issued you a link with a questionnaire to fill out. That helps us get a baseline of where you are before we start tinnitus management. And then we can track that throughout your treatment to be able to identify, are you improving? And at what point are we considered you to be graduated or a near to total success with your tinnitus?
Thank you so much. In your experience, 2025, summer 2025, as we're here, we want to give the most up-to-date evidence and insider knowledge. What treatment modalities are showing the best evidence for long-term relief?
Sure. So when we look at scientific evidence, I'm a huge, huge fan of scientific evidence. As Dr. Ben said, I'm involved in a number of guidelines committees. So I'm always trying to stay on the up and up with the latest publications that are coming out from around the world. And what we continue to see is that the scientific evidence supports that cognitive behavioral therapy, or CBT, has been shown to be top tier. It is also very strongly supported by the American Academy of Otolaryngology. They wrote some guidelines for tinnitus back in 2014. They're currently in the process of being updated. And they also gave it a gold star for working to help manage tinnitus. I stress CBT because oftentimes when patients come to us as tinnitus specialists, and we talk about how we want to incorporate the mental health aspect, the psychological aspect of tinnitus, there sometimes is some resistance, when really that's where the evidence lies. That's where the success and continued success and long-term success is really showing. So definitely CBT. In addition to CBT, hearing aids and sound therapy, they also can show great long-term improvements and long-term outcome. And even more so when we take what's called a multimodal treatment approach. It's kind of a mouthful there, but what it means is we use more than one approach to help improve your tinnitus. So we may use the auditory approach of the hearing aids or the sound generators or a combination of the both, in combination with maybe psychological approaches like cognitive behavioral therapy, mindfulness, something along that same pathway to have the greatest outcome. And so while the cognitive behavioral therapy is really working on that psychological component, the stress, the anxiety, the depression, maybe some of the conscious or subconscious barriers we're putting up for ourselves as tinnitus patients, the sound therapy component is working on helping the neural changes happening in the brain that can help to promote that habituation or those changes in the brain to help neutralize that tinnitus sound for the individual experiencing it.
Wow. So in your years of experience, does tinnitus get better for most of your patients? I think that highlighting the hope, the encouragement here is really important for everyone listening.
Yeah, absolutely, for sure. I would say that the vast majority of my patients have success with having improvement in their tinnitus. And patients, you know, you're not alone if you're sitting at home and you're watching this and you're thinking, no, my case is too complex. My tinnitus is too severe. I don't have hope. My tinnitus is not going to get better. That's absolutely not true. Even if somebody's told you that before, sometimes healthcare providers will unfortunately tell patients there's nothing you can do about it. You have to live with it. And that's simply not true. I have worked with patients with the most catastrophic tinnitus, extremely depressed, very medically complex, and they also had positive outcomes and were determined to be success stories.
Love that. How long does it typically take to see results from tinnitus treatment in your experience working with your patients and also your knowledge of the research and the literature?
Sure. So my best cases, the cases that I really wish I could emulate, that I could make happen for every single patient, is when a patient comes in for an appointment, and if they are getting sound therapy or they are being fit with devices, that I go ahead and I program the device as it's needed, as it's prescribed for the patient, fit the devices to the patient, and in that same appointment, they have what they perceive as relief. This can happen. I have had adults, grown men, grown women break down crying in my office of how they could not believe that just in that one appointment, they are already experiencing relief from their tinnitus. In full disclosure, that's not the experience for everyone. If you don't have that moment in your first appointment, in your second appointment, your third appointment, that's okay. It doesn't mean that you're not on the path to success, that you're not on the path to getting better. Everyone is different. The average patient starts to find early relief in about 4 to 6 weeks once they start a tinnitus management plan. And long-term, I would say more consistent relief is noted closer to 6 to 12 months for tinnitus patients on average. There were studies by Dr. Jastreboff and Dr. Hazel that looked at tinnitus retraining therapy. So Dr. Jastreboff is the father of tinnitus retraining therapy, which is a technique that we use at Treble Health that's widely researched and widely supported to be a great success tool for tinnitus. And their evidence did show that this study, and over the years they've reproduced these studies, have shown that the TRT patients can have significant success within about that 6-month period. I'm going to tell you though, every patient is different. If you get a bruise and I get a bruise, we're going to heal differently. And so just because we're healing at different speeds does not mean that something is worse with a person who's not healing as fast. I have had patients that have had tinnitus management longer than 12 months. That's okay. We work at each patient's speed. Sometimes there's cases that are more complex and we have to work at those different comorbidities, meaning if they have other health issues, we have to also co-manage with an interdisciplinary team, meaning other healthcare specialists. But you will get there. We will get you to that finish line. And adherence to your tinnitus program is also such a key factor to finding relief, seeing those results. Sometimes it's easier and more digestible when I compare it to If you want to lose weight or you want to get a beach body, I live in South Florida, so I use beach body a lot. You can know that you've got to change your diet. You can go to the gym, or you can get a gym membership, and you can hire a personal trainer. But if you don't follow the routine that your personal trainer instructs you to do, if you don't actually go to the gym on a consistent basis, if you don't follow that diet consistently, you're not going to achieve the outcomes that you're trying to achieve. And not because the diet and the gym isn't working, it's because you're not adhering to that program. And the same with tinnitus management. It's so important to keep up with wearing your devices, going to your appointments, implementing the techniques that your specialist talks about with you. And if we recommend that you see another healthcare specialist to help manage a co-symptom, to follow up with that as well. I saw in the chat that there's individuals that mentioned dental issues or other issues they're experiencing. Those are things that we're going to co-manage with those other specialists. So if you follow the path and you adhere to it, then definitely great outcomes can come for you.
Thank you so much. And in your experience, what role does the patient mindset play in achieving success? How they're approaching their thoughts, their thinking patterns, what is possible, examples of other people. What role does that mindset play in getting better?
So the brain, while we might perceive the tinnitus in the ear, some people have it in their head or in their ears, the tinnitus is actually happening in the brain. And there is a large part of tinnitus that there's a psychological component. And so patient mindset is so critical to positive outcomes, to patient success. Catastrophic thinking or thinking, my tinnitus is never going to get better. There's no hope for me. There's nothing I can do. That just really amplifies the distress that you can be experiencing, which is counterproductive and a hindrance to improving your tinnitus. An example I like to use, I know I've used a lot of examples here, but I think examples help bring it home, is stress to tinnitus or catastrophic thinking or poor mindset to tinnitus is a lot like fuel to a fire. It just continues to make it burn, make it grow. And we want to change that. It's really important for patients to know, patients that are watching now, patients that contact us in the future, that there is something that can be done for tinnitus to maintain hope, keep a positive mindset that your tinnitus can be improved. And oftentimes, once individuals realize this, once they have an understanding of what's happening in their brain, what's happening in their body, what are these psychological components that tie in, the anxiety can drop. And then when the anxiety can drop, it can also help us to improve our mindset and be more focused and proactive on managing that tinnitus. And psychoeducation or education about the tinnitus can be helpful in what we call demystifying tinnitus. We can help remove fear. We help to remove confusion. There's a lot of times misconception, social media, there's a lot of good things, but far more, I think, false information out there. So we can clear that up. And as an example, I just saw a patient the other day that is a music teacher. In just one visit, when I had a follow-up with them, they said, just that one first visit that I had with you, where you helped me understand what I'm experiencing, when you helped me clear up my misconceptions, my false beliefs about that I was going to lose my hearing, that I was going to have to stop being a music instructor and performer, and that my tinnitus wasn't going to destroy my career. He's like, that alleviated so much stress and anxiety that I'm in a much better place to move forward with managing my tinnitus. And that just happened maybe 2 days ago. So I just like to tie home those real life things that we're seeing in the clinic.
I love this. You're bringing so much passion and knowledge to our audience here at the summit. Dr. Tricia, how do you personalize tinnitus care for each patient? What does that mean for those listening? What is the best treatment for tinnitus? Depends on who is the individual that needs the treatment. So can you talk us through your typical decision tree on how you personalize that?
Sure. Personalization comes from listening to the patient, listening to what they're experiencing, how the tinnitus is impacting them. And based on that, I curate an individualized care plan for them. What helps guide or aid this decision making is also the use of those questionnaires that I talked about earlier in this topic, where maybe we use something called the Tinnitus Functional Index, the TFI, or the Tinnitus Handicap Inventory, the THI, to gauge where the tinnitus is most bothersome for you. And then I can focus on those key areas. That's what we're really going to work on in our appointments, rather than, if sleep's an issue for you, but relaxing is not, we're not going to focus on relaxing. We're going to focus on sleep. So that way, we're really making sure to target what those key issues are for you. The other thing for personalized care is I think it's so important that we consider your family, your significant others, somebody that spends a lot of time with you and sees how tinnitus affects your life, because they can be a great supporter for you. They can also be a great cheerleader for you. So if maybe you feel as you're going through your tinnitus management plan that your tinnitus is not getting better, then the spouse may say, you know what, honey, I actually find that you're sleeping better, or you're tossing and turning less, your mood is improved. You are even willing to go out to dinner with the neighbors the other night, which you haven't done in months because you said your tinnitus bothered you. So they can be a reinforcement if there's improvement. In fact, that's an area of passion for me, is looking at this, how the significant other can be important in your personalized care plan. And I've had publications on this area of just how important it is to have the family or significant other involved. So whether they're able to come to the initial consult with you or be able to attend some of your follow-up visits if possible, then that's ideal. I know it's not possible for everyone based on work or personal schedules, but when possible, it can certainly be a tremendous area of support. The other thing is I mentioned comorbidities. Comorbidities like anxiety, depression, sleep issues. If sleep issues aren't because of the tinnitus, maybe you have sleep apnea that's not managed. We want to make sure that we are bringing in those other healthcare specialists to your tinnitus care team to make sure that we're addressing all of the components that may be contributing to your tinnitus or exacerbating, or another way for saying worsening or irritating your tinnitus. That's really important. Again, my approach is treating the whole person. So you're not just your tinnitus. There's all these things that build layers. Oftentimes when we take those layers away and address them, we find the tinnitus that looked like it was this big is actually smaller and much more manageable. And the last thing is we fit you with amplification. If we fit you with sound therapy, we want to tailor that to you. What are your specific needs? What are your counseling needs? And again, all of that goes back to the information that you provide us at the very beginning, the information you provide us through your follow-up visits, those questionnaires, and feedback from your other healthcare specialists.
Incredible. You're here at the Weston, Florida location. Could you explain who is the kind of person that should consider coming to the clinic and what the clinic offers in South Florida?
Sure, absolutely. So if you live in the state of Florida, or you want to travel to Florida, then I offer both in-person as well as telehealth visits for patients interested in seeking care with their tinnitus. The right candidate is somebody who's experiencing tinnitus and they're bothered by it, and not just bothered by it, but motivated to do something about it. If you have your tinnitus and right now you're just information gathering and you're not ready to move forward yet, that's okay. Call us when you're ready. But if you are ready to take that next step, then I would encourage you to go ahead and schedule that appointment. Here in the South Florida location, I offer everything from hearing tests. We can do hearing tests right here in the office if you haven't had them yet. Dr. Priscilla had talked about hearing tests and those otoacoustic emissions tests. We have the capability to do that here in this office. We also offer the Tinnitus Retraining Therapy, the TRT, so meaning I could fit you with your devices, whether it's hearing aids or sound generators, or both those combinations, hearing aid and sound generators, as well as provide you your counseling and education. I am happy to take what we call a hybrid approach. So if you need a hearing test, you can come in and do the hearing test here. If you need devices, I can fit your devices here. And then we can do your follow-ups via telehealth if you prefer. So it can be, I try to tailor it to what suits each patient individually to make sure that you can adhere to your plan and be on the path to greatest success. We also, I'll put on a side note, we also, as of this week, also just started, we have a acupuncture physician in the Weston office as well. And while scientific evidence does not necessarily say that acupuncture can directly result in changes in the tinnitus, scientific evidence does support that acupuncture can certainly promote relaxation. And from relaxation, there can be a secondary benefit of improving tinnitus. So if you're in the local area and you have been looking into receiving acupuncture for stress management or maybe another health condition, that is also available in our office as well.
Thank you so much. We have some questions. Do you have a few minutes?
Of course.
Okay, the first question is from Mike. Mike asks, live here on the summit in Zoom, Mike asks, I've always had low tinnitus, but recently had a health scare which increased it. I also have a high level of hearing loss, and I can make my tinnitus louder when I move my jaw. I'm trying to figure out what to do.
Yeah, so that was a great question. I actually bounced back to Mike in the chat with a brief response for that. So Mike, just in case you didn't see it, and for the rest of the group that may not have seen it, sometimes individuals can have tinnitus that's not bothersome, and then something can happen. Maybe there's a health event, maybe there's a stressful event, and all of a sudden that tinnitus that once was not bothersome now has become bothersome. And you know, I'm certainly sorry to hear that. If that has been something that you've experienced, in positive news, we can work with that to bring the tinnitus back down to a manageable and less bothersome level. And that can be through, again, whether it's sound devices, counseling, a combination of the both. And as for the jaw issue, tinnitus certainly can be related to somatic changes, meaning movements of the jaw, movements of the neck, movements of other parts of the body. So sometimes if there is a jaw issue, if there's TMJ or TMD, a temporal mandibular disorder, sometimes if your bite is off, if you grind your teeth, there's just different things that could certainly irritate your oral dental area. And the pathways from the jaw to the brain take a very similar pathway as the hearing pathway takes from the ear to the brain. So sometimes the movements from an irritated jaw response can be perceived in turn in the brain as tinnitus, as a sound, believe it or not. When that happens, if you are noticing a pretty decent change in your tinnitus with jaw movement, we would want you to follow up with your regular dentist that you see and explain that to them so they can do a screening on you. Sometimes it's as simple as a properly fit bite guard that can provide relief. Sometimes the dentist will then want you to do certain at-home, maybe ice or heat, or doing certain trigger point massages, which has been helpful for some of my patients. And then honestly, sometimes it's more involved and other kinds of dental treatment may be warranted, but really that's up to your oral specialist to be able to identify what those needs are. So co-planning of managing the somatic component of your tinnitus with the dentist, and then working with your tinnitus specialist to work on the stress increase as well as the tonal increase from that stress event.
Excellent. And this will be our last question. It's from Tim. Tim asks, can you give a high level of CBT, cognitive behavioral therapy, and what that entails? Just a caveat for everyone listening. Cognitive behavioral therapy in its full comprehensive form is provided by a therapist or a psychologist. Certain techniques from that approach are used by audiologists to specifically address tinnitus and the effects it can have related to anxiety, stress, or insomnia. So, Dr. Tricia, can you give a high level of CBT and how could it help tinnitus?
Absolutely. So the way CBT works is the way our thoughts, our feelings, and our behaviors all influence each other. And so sometimes when an individual will perceive tinnitus and they will start to have these, what we call cognitive distortions, or improper thoughts about their tinnitus, and based on those thoughts, they then may modify their behavior, not because a specialist told them to modify their behavior, but because the patient feels like they are doing the right thing to manage their tinnitus. So for example, if you're experiencing tinnitus, somebody experiencing tinnitus, they might think, I shouldn't leave the house anymore because if I leave the house, my tinnitus is going to get worse. So what do? They stay in the house all day. What is that going to do? Not be helpful for the tinnitus. So that's a form of like a cognitive distortion and an improper pattern that an individual has set up for themselves. And so CBT, what we do is we help to work with identifying what are some of these cognitive distortions or these improper thoughts about tinnitus, and where do they come from? Whereas maybe was it told to you by a friend or family member or something you saw online, or maybe even from a misinformed healthcare provider. And then helping to restructure those thoughts. There are different exercises that we can do to work on those. And then another really common thing is relaxation techniques. So whether it's breathing techniques or different types of exercises that we can engage in that help us to calm, help us to reduce stress, help us to reduce anxiety. The exercises aren't just simply breathing in, breathing out. They have a purpose. These exercises can help to affect what we call our autonomic nervous system, to help our fight or flight response, put us into a more calmed state. And so those are two like very high level examples of what we can do with cognitive behavioral therapy, but really helping to help modify your thoughts and your feelings and your behaviors that may have been altered because of the onset of tinnitus to put you back into a healthier state overall.
You're amazing. Let's give a warm round of applause and congratulations, gratitude to Dr. Tricia Scaglione out of South Florida. Thank you so much. This was insightful, passionate, and one of the comments I saw in the chat was Dr. Tricia is an excellent speaker. We have over 250 people with us live, thousands more who will watch the recording. So Tricia, thank you so much. This will impact many people and get them in the right headspace. I think I like what you provide. I've found is a great combination of like evidence-based knowledge, but that sort of that like tough love coach mentality that can really get people to where they need to go, have them doing the things they need to do. So I'll give you the last word here for the community. But yeah, I just want to say thank you so much for presenting at the summit. And if anyone would like to work with Dr. Tricia, if you're in the state of Florida, reach out. You can go to treblehealth.com and go to our locations tab and select South Florida. You can schedule a Zoom consultation with her, or you can come to the clinic and meet her in person.
So thank you so much, Dr. Ben. Thank you so much for everybody that tuned in. My message is just remember there is something you can do about it, and spread that. Help to spread this positive message. If you do talk to other individuals experiencing tinnitus, encourage them to reach out to Treble Health or their local tinnitus specialist so they can start having beginning their tinnitus management journey, and the same for you. So hopefully you found this beneficial, and I look forward to seeing many of you. Thank you.
Thank you so much. And Tricia, if you have a few minutes, I'd love to ask you a quick question. Getting everyone on the same page here. This is today's schedule. So we just completed 4 of the 6 presentations. I'm up next. I'll be discussing tinnitus clinics versus telehealth, what you need to know. And then we'll have Steve, a graduate of tinnitus treatment, someone who has a success story to share. If you guys were here at the beginning, then you do not need to do this part. But if you joined after the first 5 minutes, excuse me, after the first half hour, then I'd like for you to complete this poll. And I'm going to launch it right now. For those who have not completed it, we're going to launch it right now so you can enter to complete the poll. It takes about 2 minutes. While this is going on, Dr. Tricia, I'd like for you to tell us a story about the Florida clinic. But for those who have not completed the poll, you'll see a pop-up on your screen right now, either on your laptop or your phone or your tablet. And you can go through those 15 questions and answer them. It helps us understand why you're here. We can give some advice on what to do next. It also helps us understand if you're close to any of our clinics, maybe we could help you. So with that in mind, we'll let that run for 2 more minutes. Dr. Tricia, in the Florida location, the clinic itself is right next to this water, essentially a pond, and in the water there's an alligator. So it's a very unique experience there, because patients who come to our clinic in Florida, right outside of your treatment room window, can actually see an alligator. So would you care to share some stories about how this alligator has appeared during your appointments since you've been working at the clinic?
Sure. And sorry, I definitely, I knew where you were going when you started to say that. Just makes me laugh. I really appreciate our little office mascot. So I was on telehealth a few weeks ago with a patient who was located a few hours from me here in Florida. And out of the corner of my eye, because the windows here, if you come to the office, you'll see there's windows in the different areas of the exam room, and actually in all of our clinical spaces here. And something started moving, and I looked out and I glanced and I realized there's an alligator swimming by. And so I had a little laugh, and I told the patient that was on Zoom with, and I said, hey, right now there's an alligator that's swimming by the session right now. And I have to say, in my career, in my 15 plus years, this is the first time in my life I can say, in the middle of a patient appointment, an alligator swam by. I just feel like that's such a Florida thing to occur. And I've lived in Florida 20 years. And so my patient loved it. And we were having the grand opening celebration the next day. So he made a little comment about that the alligator was coming early for the grand opening celebration. And so I shared this in our team chat. We have Slack. If anybody's familiar with Slack, we have Slack. So I Slack the team, hey, we know we have an alligator in the Weston location, and the team decided to name it. And so his name is Buzz. He's our mascot. And most days, I will say most days between 12 and 2 o'clock, Buzz likes to come out and take a little afternoon swim and swim by. And so when he's swimming by, I do point him out to patients, and I would say 99% get excited. I did have one patient recently that was like, yeah, I mean, I've seen gators, but kind of broke my heart that I was like, hey, here's Buzz for you. But if Buzz is not swimming by for your appointments, we do also have lots of turtles that like to go by and pop their little head up. And I was asked recently if we have any pythons or water moccasins. Being right next to the Everglades, there's a high chance we do. Fortunately, I have not seen one, and I really hope that we don't see one. We don't need that office mascot. We're good with one.
Thank you so much. That's amazing.
You're welcome.
20 more seconds here to complete the poll. Thank you to the 20 of you who have on Zoom. Dr. Tricia, continue the great work you're doing down there. It was a joy to be there for the grand opening. I will be back. And for those of you who are on our YouTube channel, you can expect to see some educational videos by Dr. Tricia. So follow the Treble Health YouTube channel. If you do want to work with us in person in Florida or have a telehealth consultation with Florida, we have the Weston Clinic location in the chat right now, as well as in the YouTube live stream chat. So thank you guys so much. And Tricia, enjoy your evening. Enjoy your summer in Florida.
Thank you so much.
All right, next up, I'm happy to share that I'll be presenting on the tinnitus clinics versus telehealth, what you need to know. So let me go ahead and get things started. All right, so in today's talk here, I just want to make sure that my face is on the screen and everyone can see me full screen. Okay, very good. All right, guys. So for those of you who don't know me, my name is Ben Thompson. I'm an audiologist, co-founder here at Treble Health. I specialize in tinnitus. I studied tinnitus in San Francisco and had an amazing mentor who led me to eventually work with Dr. Paul Jastroboff, who's the founder of Tinnitus Retraining Therapy. And I have hosted hundreds of podcast interviews and hosted researchers, scientists, et cetera, in the tinnitus treatment space. So all the knowledge I'm bringing from the science, the research, the guru himself, Dr. Jastreboff, myself working with patients. Now we have a team of 10 audiologists at Treble Health who specialize in tinnitus. We have done over 2,500 tinnitus treatments with patients via telehealth. And now we have physical clinics, 3 locations, San Francisco, California, Weston, Florida, and Charlotte, North Carolina, with more clinics to come. I wanted to address to you all addressing the how to get better. Hopefully in the summit so far, for those of you who are listening to the summit, and if you want to watch the full summit, we have it right now. It's on the YouTube, our YouTube page, Treble Health. Go to the live video section. You'll be able to watch the whole recording immediately. But the graduates have shown you that you can get better. The audiologists who presented have explained how and why you get better and what that looks like, who you work with, etc. But I want to discuss the modality of considering help via a telehealth operation versus going to a physical clinic. I want to start by simply addressing what I think are the main points in this conversation. There are some challenges in the tinnitus treatment world. The biggest challenge is that most people go to a doctor for their ears. They get a hearing test. They meet with an ENT doctor. They're trying to solve this bothersome ringing and hissing and sound in their head, but they're told one of these things. They're told, hey, this is caused by hearing loss. Try a hearing aid. They're told, sorry, there's no cure for tinnitus, or you just have to get used to it, or sorry, there's nothing you can do, or there's a few things you could try, but they might not work, and I don't specialize in that, so here's a pamphlet. Good luck. That is a horrible experience. Unfortunately, many of us here, many of you all listening, have had that kind of experience. So there is a better way, and we need to change that. That's what we are actively working on doing at Treble Health. What I would like every person with bothersome tinnitus to do is be able to speak to a specialist, someone who has had extensive training, who can answer all the questions, who can give you a case-specific roadmap and guideline moving forward on what you need to do. The problem is that there are not many tinnitus specialists in the city that you live in. I know at the beginning of this summit, everyone said, I live in Minneapolis, I live in Orlando, I live in Los Angeles, I live in Denver. Unfortunately, most cities do not have a good tinnitus specialist. Most towns definitely do not have a tinnitus specialist. That means this is not as simple of a decision as should I go to a clinic or should I try telehealth, but this is actually a more nuanced discussion of how valuable is the specialist I'm working with? Is there someone in my town that's actually a specialist? And what are the limitations of telehealth compared to the clinic? All right. So in a clinic, you can get access to every possible test and every possible treatment for tinnitus. However, if you don't have a specialist there who really works with tinnitus, then you aren't going to have a good experience. The telehealth space, working over Zoom, having devices remote programmed, that has some limitations, which I'll explain. All right. So I want to share some images on the screen right now. First, comparing the two models. Let's talk about the physical exam. So in a tinnitus clinic, you can get a hearing test, and a very specific hearing test can measure things like high frequency audiometry. It can measure things like OAEs, otoacoustic emissions, and that can give us a more specific assessment of why do you have this tinnitus, okay? But let me make things very clear. A hearing test just gives us a pretty binary yes or no answer. Do you have some hearing changes or not? A vast majority of you have changes to your hearing system. All right. You might say, but Dr. Ben, I don't really have a hearing problem. I just have this tinnitus. I don't have a hearing issue. The objective test shows that your hearing isn't what it used to be years ago. And if a standard hearing test is normal, we can get more specific with high frequency audiometry, which is very high pitch sounds, and see, oh, did those sounds show some loss? We can also look at the OAE test, the otoacoustic emission test, to see, hey, those little hair cells deep in the ear, do those cells show that they're not functioning as well as they could? That's all that's needed to trigger the chain of events for someone to have tinnitus. All right. So in many ways, those tests give us information, which can help us tell you, again, that binary thing of, is part of this related to hearing loss or not? But that test by itself is not, those specific high frequency audiometry and OAE tests, they're not required to undergo tinnitus treatment. And that's proven by via telehealth over the last 4 years that we've been seeing a high volume of tinnitus patients, that in the telehealth space, we have not needed to have these in-depth hearing tests in order to provide an excellent tinnitus treatment. Because again, we're understanding the binary component here of, does this patient have some changes to their hearing system or not? All right. What a tinnitus clinic does not do is assess for the more nuanced cases of ear disease, jaw abnormalities, neck abnormalities. However, any modality here, telehealth or tinnitus clinic, we can assess whether we think someone needs to go to another medical professional to have that go simultaneously with our approach that we're doing with our patients. So the physical exam piece, you can get it in a tinnitus clinic. You do not get it in telehealth. However, when we work with patients, we require a hearing test before we actually start the treatment. So in the telehealth space, that's what we require. We would send someone to get a local hearing test. We would cover the cost for that. In the tinnitus clinic, the physical exam would be either conducted at the clinic itself, or the patient would bring their hearing test. All right. Second important feature to compare the two different models, the access to the specialists. So in your town, in your city, let's say within a 90-minute drive, because most people don't want to drive more than an hour, but maybe with tinnitus, we really want to do anything we can, so we would drive far. Still, most people do not live within 90-minute drive of a true specialist for tinnitus, an audiologist who specializes in the diagnosis and treatment of tinnitus, someone who's trained with their mentor, someone who's put in years into this, someone who's very good. That will make a lot of difference. With telehealth, we've been able to recruit some of the best tinnitus specialized audiologists in the country and have them work at the Treble Health team. And we connect the audiologist who's licensed in the state as the professional, as the patient, excuse me, and we conduct the appointments remotely so we can pair top tier, top 1% specialists with someone in a specific state in the country who needs that kind of expertise to get the job done. For technology, how comfortable is a patient with technology? So if you're able to download apps on your smartphone, then you will do extremely well with telehealth. You'd be amazed, and I've been amazed over the last 5 years, how sophisticated this technology is. The capabilities of hearing devices like hearing aids, for example, in the remote care model are so good, where we can do 95% of what we'd want to do, or what we would ever need to do with hearing devices. We can do that via telehealth. In a tinnitus clinic, you could do the same things. However, in a tinnitus clinic, there's also the option to do something called real ear measures, where if a patient has a significant hearing loss, then verifying the hearing devices with real ear measures is often recommended for hearing loss. There's some caveats to that, where sometimes for tinnitus, we don't want to put the hearing aids too loud, but still having that verification tool is important. And for patients that we determine need that in the telehealth system, we send them to a local clinic to get the real ear measures verification. All right, so for the convenience, for the tinnitus clinic, you have to travel, you have to take time off work. The convenience is relatively lower, although it may be a better experience to see someone in person and have that human-to-human connection. Whereas the telehealth space, it's a higher convenience. You can do it from home. We ship the medical devices to the patient's home. It arrives there within 5 business days, and then the person can meet over Zoom. We have a specific appointment to do the technical setup of the technology through your smartphone. It works very, very well. You still have a human connection, but you're not shaking hands, giving a hug to your doctor. The cost for tinnitus clinics, typically the costs are higher in a clinic due to a higher overhead for the business to manage with the clinic space and the rent, et cetera. But in the telehealth tinnitus treatment space, the cost is often lower. Okay. So as I had mentioned, at Treble Health, we have 3 locations. Each of those locations can provide diagnostic assessments. I wanted to briefly show on my screen here the full list of. I wanted to briefly on my screen here show the full list of diagnostic assessments that can be done in a clinic. So this is pretty much an exhaustive list of what someone would ever need to get measured for their tinnitus at an audiology clinic. All right. Pure tone audiometry, that's a hearing test. Speech audiometry, part of the standard hearing test. Tympanometry as well, that measures the eardrum function. Acoustic reflex testing is typically not done with tinnitus patients. It can make things worse. OAEs, we spoke about that. Tinnitus pitch and loudness matching can be useful for education, for identifying what exactly you're hearing, but does not dictate the treatment, does not really give us any actionable steps on how should we make your tinnitus treatment different. Okay. Minimum masking level, same thing. Gives us some information, but not really that useful besides education for you. And then residual inhibition testing. This one's interesting because if you go into a audiology clinic where there's a tinnitus specialist, if we measure your tinnitus pitch, if we measure the masking level required to reduce it, if we get these kinds of information, then we can do something called residual inhibition testing, where if your tinnitus is 6,000 hertz, for example, then we could play a narrow band of noise around 6,000 hertz. And if we play that for about 1 minute at a loud volume, and if we turn it off, then many patients will experience silence. But that silence only lasts for about 1 or 2 minutes. So it's actually pretty similar to that effect that you may have seen. I'll put myself full screen now. It's actually similar to the effect you may have seen where there's that approach to that you may have seen on YouTube or something, where someone can put their finger behind their ear, and if they tap for a certain amount of time, their tinnitus can temporarily be silenced. So we can actually kind of mimic that in the hearing booth with a specific band of noise, showing us the power of sound therapy. But really, that's more of just a way to build trust with the patient or to do something to shift their tinnitus, to show them that changes can be made. That's not something that we would incorporate into a treatment, and that's not something that's done in that way. All right, guys. So with that in mind, I would like to share a short video from Dr. Melissa Karp. She has a full schedule of patients today. She's busy today, but I wanted to feature an interview I did with her on this summit. So for 5 minutes, we're going to listen to Dr. Melissa Karp, and then following that, we're going to have Steve, who's a graduate. He's going to share his tinnitus success story. So let me go ahead and pull up this message from Melissa Karp, and you guys can hear from the top tinnitus specialist in Charlotte, North Carolina, and get her perspectives on what she typically does with her patients in her clinic. Right after that, we'll be meeting with Steve for his tinnitus treatment success story. Steve, if you're here right now, we're going to get you up on the panel. And let's go ahead now and play the message from Dr. Melissa Karp.
When you come in, like I said, you've got a 90 minutes of time. We do a comprehensive hearing test. We also do a test called DPOAEs, which for people that aren't familiar with that, sometimes when you do a hearing test and you do the beeps, you get perfect hearing. That doesn't necessarily mean that there's not a little bit of damage to that part of the ear, the outer hair cells, that can, create tinnitus. So we actually have some tests that maybe not every audiologist may do, so that we can be very careful and evaluate your hearing fully and give you the best picture of what's going on in the auditory system. If we end up doing any type of device fitting, we always use real ear verification. We use best practices. As far as what it looks like coming in, it's a lot of talking. It's a lot of talking, a lot of back and forth, a lot of listening on my part. Yes, I want to educate, but I want to hear what's going on in my patient's life. And I want them to understand what's happening at the level of their ears and what's happening at the level of their brain, because it's all about the brain. We're using the ears to get to the brain, but it's all about the brain.
Wow, I love that. So patients, thank you so much, guys. So, all right, guys, thank you so much. Dr. Melissa Karp is excellent. If you're in the North Carolina area and want to get in touch with her, we do offer telehealth consultations, as well as in-person diagnostic evaluation and treatment consultation as well. So we'll put the link to the Charlotte, North Carolina Tinnitus Treble Health location in the Zoom chat. And we're now going to bring up Steve, who is our Treble Health graduate, who is here to share his story and provide real techniques, tools, perspectives for you guys. So we're going to get Steve up as a panelist. He's going to share his story here in one moment. Let's just hear it from a few of you guys in the chat. Who was your favorite presentation today? Was it Mike, the success story? Was it Dr. Suzanne? Was it Dr. Priscilla? Was it Dr. Trisha? Share one or two of your favorites here in the chat as we get Steve up. And thank you guys so much for being here. We're going to round out the Tinnitus Summit with Steve coming up next. Steve, if you could please raise your hand or comment in the chat, that would be great. Okay, I see. Got it. Steve, I see you here. All right, we see Clayton says all the presentations were amazing. Julie, all were fabulous. Michael, Dr. Priscilla did a great job. Elizabeth, all of them were amazing and so helpful. Maria, everyone was great. Dr. Trisha brought it home for me. We have more love and praise coming. And Elizabeth says all the presenters were unique and so knowledgeable. Thank you guys so much. Well, stay with us, okay? Because we're about to bring it home and things are about to get hot. We got Steve coming in, and Steve's about to share his success story. More importantly, he's about to share perspectives and insights that could help you. So, Steve, welcome to the Tinnitus Relief Summit, Summer Edition 2025. How are you doing today?
I'm well, Dr. Ben. How are you? Can you hear me okay?
I sure can. As we're getting set up here, I want to ask you first, can you close that blind behind you? And as you do, I'm going to, because it's going to help the lighting. And as you do, I'm going to give you an introduction here. Okay.
Yep.
All right, very good. Guys, we're here today with Steve. This is the patient success story portion of the Tinnitus Summit. Steve transformed his tinnitus. He graduated from our program at Treble Health. We reached out to our graduates and said, hey guys, we're doing this summit. Anyone want to share their story to help others? And Steve said, sign me up. Steve's initial tinnitus functional index score, where we measured tinnitus from 1 to 100, his initial score was a 75 out of 100, which is a very serious problem, which we're going to learn about today. His most recent score on a scale of 1 to 100 was an 8 out of 100. That's a dramatic reduction. He's going to share exactly what happened. And hopefully, if you're listening, this will give you the hope, the encouragement, and some of the tactics and the actionable steps that you need. So, Steve, let's start by giving an introduction. Steve, what do you do for work? Tell us about yourself before we begin.
Oh, I am just had my 66th birthday in July, and I'm a corporate attorney, and I've been practicing law for close to 40 years and live in the Boston area. 6 kids, happily married. My youngest is 22, my oldest is 38. So lots going on in my life throughout the years.
Thank you so much. Busy man and
Busy man.
making a big impact. So let's talk about your ears now.
Yep.
First, give us an update. When you first met with us, your tinnitus was really severe. When we last met with you, it was very mild. Has it remained mild? And talk to us about what are your symptoms these days?
Yeah. Well, so much of what other folks talk about really resonate because I think I've experienced, most everything that others have talked about. But, I had tinnitus at a very low level for a number of years. It was not an issue. It was more a curiosity. It was something that was just there in the background that I'd hear maybe if I was going to bed or just lying down doing some stretching or whatever. And then literally one night it just exploded in terms of the invasiveness, the volume of the sound. Don't ask me why. I do have some some neck issues in terms of deteriorating discs. Could that be a contributor? Maybe. But it just blew up on me in a day. And, given my line of work, I feel that I'm a pretty in control kind of guy with my emotions and whatnot and managing stress. But getting whacked with tinnitus like I did, sort of just out of left field, it freaked me out. There's no question about it. And it kept me up at night. I couldn't sleep. I remember saying to my wife, it's like, I can see how people would kill themselves over this. This is horrible. We're in the Boston area, lots of high level medical, resources. I went to Mass Eye and Ear, which is part of the Mass General Hospital, which is, a highly regarded medical center. They have a tinnitus clinic. I got a hearing test. I had, some deterioration at high frequency. The clinician at the time said, yeah, you're sort of on the cusp of hearing aids. And then he talked to me about things that they could do, which at the time I didn't know what he was talking about, but what he was talking about was sound therapy. And then I said, well, that sounds great. When can we get started? And he said, well, make an appointment. And the first appointment was 6 months in the future. And I said, I can't live with this for another 6 months. And my wife did some research. She's found Treble Health. I called up. I got connected with Dr. Suzanne. I got my hearing aids with with the sound, had some enhancement for hearing as well as the sound therapy. And I remember the first call I had with her, and that was probably about a year ago. And I said, well, we've got a trip planned to visit the youngest kid who's studying abroad. And we're trying to leave the end of October. She says, that won't be a problem. You'll be fine by then. You'll be fine by then. So I think that, getting getting put in touch with someone who was, in this case, Dr. Suzanne, who could talk to me about what was going on, could, describe a path to, a better place, and then getting, the hands-on treatment in terms of the maskers, the hearing aids with the sound therapy. And I'll tell you, one really big game changer was you having the having the whole kit that comes from Treble Health, not only the hearing aids, but the headband for nighttime wear. And that was huge for me because I knew I could go to bed and I could go to sleep. And before I had the headband, as an accessory, the anxiety over whether I was going to be able to sleep at night, or actually knowing I'm not going to be able to sleep at night, that just ramps up everything, right? So once I was sort of plugged into, hey, I've got resources, I've got something that I know is going to help me go to sleep at night. That just, that takes down the anxiety and everything what we've talked about in terms of the mind, the brain. The anxiety goes down, the tinnitus goes down. We traveled to the Czech Republic without any problem in October. And by January or so, I think I was really feeling like, yeah, I'm in control of this. Now, there's a mystery aspect to tinnitus. I don't know why it comes and goes sometimes. I mean, I can hypothesize, if I'm under a lot of stress, if I hadn't slept well, if my neck is bothering me. Yeah, sometimes it seems to be worse, but sometimes I can have all of that and it's okay. But the absence of the anxiety is, I think, what really is transformational. And then it does, reduce the volume of the sound or the frequency of it. I mean, I'm at a point now where, I may not wear my hearing aids all weekend. Maybe it's because I'm more relaxed, maybe because, absence of work, being relaxed. And now there's an expectation of like, yeah, I can just go natural over the Saturday and Sunday and not have issues. But there's so much that just depends on the mindset. Everything we were talking about mindset is true, but you need to be given the tools to help facilitate, that the process that's going to get you to a positive mindset. And, expectations are everything. You go to bed, you're going to go to sleep. You hit the weekend, you're going to be feeling well. And then, on days that I have it, like sitting here today, I can hear the sounds in my ear, probably because we've been talking about tinnitus for the last 3 hours, but it's no big deal. It's no big deal. And I know I'm going to go home, in another half hour or so, have dinner, unwind, go to bed. It's all cool.
Hey, Steve, I was reviewing the scores that we measure tinnitus, and the way we do it is when we have a new patient, we have you complete this comprehensive questionnaire. It's evidence-based. Researchers use it, scientists use it, doctors like ourselves use it. It gives the tinnitus a score of 1 to 100. Like I said, you started out as 75, which is a serious problem, but it also breaks it down into the different subcategories. And the subcategories that were the worst for you, or the ones that needed work, were the tinnitus was intrusive, that you did not have a sense of control over it. It was affecting your sleep. It was affecting your relaxation, and it was causing emotional distress. Does that resonate?
That's absolutely where I was when I was filling out those questionnaires to start. Yeah, absolutely.
Okay. And then looking at it, the most recent score, intrusiveness went from an 87 to a 23. Anything below 30 is mild and really not that big of an issue from the research. Sense of control went from an 87 to a 27. Sleep went from an 80 to a 0. We'll talk about that. Relaxation went from an 80 to a 3. Emotional distress went from a 90 to a 0. Those are some really big changes. So talk to us about how did that happen? Like for someone who wants
Yeah.
to get there, can you
Yeah.
give them some advice or share what worked for you?
For me, the headband was a huge component because I knew I would put that on, and I'm no tech genius, but I was able to figure out how to download some apps on on background sounds. And right from the first night, I knew I'd put that on, and it would enable me to just block out the tinnitus and go to sleep. And once I had the expectation that sleep was no longer an issue, that that reduced the anxiety, across the board. And again, because all right, maybe you're having it during the day. Well, I've gone through it long enough to know it may come and go during the day. But even if it's, going, going strong, when I go to bed, I'm still going to be able to go to sleep. And just taking sleep off the table as something to be anxious about just changes everything. At least for me, it did. And so that one piece of equipment, the headband, was really, really instrumental in improving my situation.
Excellent. We have a headband right here, one of the Treble Health headbands, and our newest versions of this, we actually created an adjustable band on the back of it. So if anyone is interested in that, go to our website, treblehealth.com, or send an email to contact@treblehealth.com. We'll be able to direct you towards that. Steve, how about the intrusiveness, the sense of control? These are
more
psychological or negative mental states,
right.
Lack of control, intrusiveness, can't escape the sound. They affect the nervous system. They put our body in a fight or flight. Talk to us about how that changed over time.
It changed in that when we talk about, at least in my mind, when I talk about intrusiveness, part of it is absolutely, like how is it there? Is the sound there? Is it loud? And is it preventing me from being able to concentrate on my work if I'm at work, or to relax if I'm at home? Whatever it is it intruding in what I'm otherwise trying to do? And in my case, over time, the the absolute volume and frequency declined, but at least as important was the mindset of, even if I have it, and even if it's going great guns, it's not going to get me all amped up in terms of anxiety about, oh my gosh, this isn't going to go away. What am I going to do tonight when I'm trying to go to sleep? And again, even if you have it, I could say it's physically still, loud and there, but it's not intrusive in terms of interfering with my daily activities. And so for me, intrusiveness is like, it's not interfering. So the intrusiveness is, gone way down.
I love that. I love that. So Steve, a lot of folks work in an office. A lot of folks may be lawyers, they knowledge workers, people who need to focus, people who are often in a quiet office environment. Now, I hear a lot of people saying, hey, when I'm really deep in my work, it's almost like the tinnitus isn't there.
Yeah.
But I can see how that's sort of a trap, because they say, yeah, when I'm focused, it doesn't bother me, but every other time it bothers me. So what's your advice to people who also spend 8 hours a day
Yeah.
in an office?
Yeah, yeah, it can be a bit of a mind game because, as you say, if I'm not working at something, is it going to be interfering? Then if it's interfering, does it then prevent me from being able to concentrate? What I found at one point early on, that when I went into meetings and I had, multiple people around a table talking about something, or even in a one-on-one, but especially if it was multiple parties at the table, I guess you know, my mind was focused in other areas, and it was focused in multiple, you know, different people talking about different things. And I found that it wasn't always the case, but it was very, very often the case that when I ended the meeting, it was like, oh, my tinnitus is gone. So, you know, the concentration definitely, if you can get really focused, yeah, that seems to be a way of getting rid of the tinnitus. But then you have to ask the question of like, how can I begin the concentration piece of it if I have the tinnitus? You know, is it going to prevent me from starting up in terms of what I need to do? And all I can say is when you get to a point of your general sense of it's okay. If it's buzzing right now, that's not an issue because I've been there before. I've done that. I know that if I start reading this memo or I'm starting, you know, talking on the phone or something, I'm going to be able to do that, and it's not going to interfere with me. So there's just so much. It's so much of a mental state, so you know, being in the office. In the early days, it was really bad because it was preventing me from concentrating. I remember leaving the office, having to go for a walk, trying to calm myself down. And again, being a guy who, at least traditionally, in terms of how I felt about myself, was like, yeah, I don't freak out over things. I manage the stressors of life. That's part of what I do for a living. But in the early days, it was really knocking me for a loop. But then once you start to feel there's a resolution to this, and that's where, you know, the treatment and working with someone like Dr. Suzanne helps just get you to have a sense of, I guess, faith in the process. Like, I know you're going to help me work through this. And then once you feel, you know, you've reached that point, you don't get knocked off stride, even if you have tinnitus going on at a particular, you know, time.
A lot of people here listening won't work with Dr. Suzanne. And a lot of people here maybe can't afford a program or need some guidance. So if you know, imagine you have a microphone, you're in a room, you're in a banquet hall here, there's, you know, 200 people with tinnitus who come and they say, yeah, I'm here because I want to learn from people who have been down this road so that it can be easier, you know, less painful, and it can happen faster for me of getting relief. You know, what would you say to them based on what you learned with Dr. Suzanne in your own case?
Well, I guess I would, and I can understand how, you know, in that state of mind, because I was there, hearing that there is a path forward, and it's not always going to be this way. And how do you take that first step? You know, I guess I would talk about at least some of the useful tools that I found. Okay, even if there's, you know, if there's financial pressures in terms of being able to, you know, go in and, you know, buy a, you know, high-end pair of, you know, hearing aids with the treatment and whatnot. You know, I think some of the CBD relaxation techniques can be, you know, very helpful. And I would say, you know, if the anxiety is, you know, partially or significantly attributable to not being able to sleep, I would say, if you do nothing else, go out and get a headband. You can get these devices on the internet, right? You know, try to put some real tools in their hands that could make a difference in terms of you know, dealing with the issues.
Absolutely. For those who are here and want to learn more about a sleep headband, we have our standard sleep headband. I'll just include it in the chat because I know many of you guys are asking for it. And then also, if you're on YouTube on the live, I'll put it there as well. If you want the adjustable headband version, let's say you have a really small or a really big head, then reach out to our team contact at Treble Health. Okay, so in addition to the headband, Steve, you mentioned these CBT techniques. Walk us through one or two of them that helped you, and I think this is important for people to kind of hear this from your perspective of what it feels like or what it is.
You know, I think I utilize some very basic breathing techniques for me, and if I recall correctly, you know, basically it was visualizing sort of the intake of whether it's, you know, up the nasal passages, out of the mouth, you know, the other way around, but sort of just visualizing in your mind that circulation. I found that to be very helpful. I found if I was lying down, say it was, you know, bedtime or whatnot, you know, technique of consciously relaxing sort of each part of your body, starting from your, you know, from your toes and your feet and moving all the way up progressively for your entire body. I don't know. I'm not a, you know, a therapist on this, but I think, you know, a big part of it is the concentration that you're expending in doing the, you know, doing the exercise, whether it's the breathing or sort of the relaxation technique, in terms of your going through your all of the muscle groups in your body. You know, it's getting your mind off of what was creating the anxiety to begin with.
Absolutely.
So I found both of those to be helpful to just get, you know, get it amped down to you know, off that level that was really interfering.
Definitely, guys. So, you know, you can try that for free right now. YouTube, search CBT for tinnitus, or just cognitive behavioral therapy for anxiety techniques I can try today. Those are available right now. So, Steve, I love that. Some basic sound therapy, whether it's through a sleep band like the one I'm holding here, or a high quality sound machine. That those can be very helpful, and they're easy to get started with. Or if someone has an iPhone, there's actually a setting called background sounds, which can play white noise, pink noise, these kinds of sound therapies that can help us just from your phone right now. You can get that started in the next 10 minutes. And then the CBT techniques as well. I love that. Let's open it up for some questions. So guys, if you're listening and you want to ask someone who's gotten better with tinnitus, some questions, we're going to open it up right now. Steve, the first question is coming from Julie. Julie asks, how long did it take for you to quote unquote recover? And maybe define what recovery meant for you.
So like I said, it really sort of blew up on me about a year ago, end of July. And you know, I think I was working with Treble Health by probably the end of August. And I took you know, a trip abroad at the end of October. So September, October, you know, I'd say within 6 weeks, I was, you know, dramatically different in a much, much better place. And being able to travel internationally without any fear or anxiety of, you know, what if my head's exploding while I'm on the plane or something like that.
Thank you. And that's faster than most patients. You started treatment relatively fast, which is good because early intervention is generally a good thing in healthcare. But you're you know, being able to say 3 months, you know, 2 months later, 3 months later, I'm feeling a lot better. That's quicker than most. Just wanted to add that. So glad that worked out for you. Cheryl asks, sorry. Howard asks, Steve, were you able to totally mask your tinnitus while sleeping, or could you still hear it when you were trying to fall asleep with the headband?
Yeah, that's a great question. And for the most part, if I recall correctly, sort of the instruction on sort of that masking is you don't want to necessarily drown it out completely, but you sort of want it, you know, right underneath, that you could still hear the tinnitus, but you've got the masking sound going. And for me, what I would then do is I'd be focusing on the masking sound, so that in my mind eventually, fairly soon, because that's what I was focusing on, that's all I'd really hear. So if objectively speaking, when I first put on the headband and whatnot, I didn't completely drown out the tinnitus, but I was just like a little bit below that. But then I totally focus on that masking sound, and that in effect blocks out the tinnitus. And it's just for me, it's a much calmer sound because it's something that I know I control. I turn it on and off from the head, so it's not something that's out there, the tinnitus beyond my control. The masking sound is in my hands. And so I think that also just helps create a much more relaxed state, because that sound doesn't bother you because you're the one creating that sound.
Steve, last question. This is from Cheryl. Cheryl says, hey, Steve, if I already have a sound in my brain, then why would I want to hear another sound with sound therapy? You were just touching on it. So elaborate on this.
Yeah, I know it sounds kind of counterintuitive, but for me anyway, it is this element of, this is a sound that I control. I turn it on and off. It's not just something that's been superimposed on me, ringing in my ears, and so it just, for me, strikes me as a calming influence. Because I focus on that, which does effectively block out or exclude the sound that is creating the bad vibes, the bad mental state. And I'm focusing on a sound that I control, and it's a relaxing experience, as opposed to an anxiety inducing experience.
Great answer. Great answer. Well, Steve, I'd like to give you the last word here. For someone listening, what is your main takeaway? What is the main message you want to share to people with tinnitus listening today?
I guess the main message is, for me, is be hopeful, and try to be optimistic. And I can appreciate how bad it can be when you're at the depths of the feelings. But there is a path forward, and you gotta get yourself on that path. And if you really go after it and are conscientious about it, and you've got some great resources around you, I think, through Treble Health and whatnot, you can make it. You can absolutely get to a point where this is not something that's interfering with your life.
Steve, thank you so much. I'm from Rhode Island, by the way. You see it from Massachusetts, so we're basically neighbors. Thank you so much for sharing. You did wonderful. Let's give a virtual round of applause and show some love to Steve, the corporate attorney who got better with tinnitus, who's now sharing his story. Steve, thank you so much, and I hope to see you soon. All right.
Thanks for having me, Dr. Ben.
You're welcome.
Take care.
Guys, long-lasting relief from tinnitus is possible. You're here at the Tinnitus Relief Summit, Summer Edition 2025. I want to end it by saying thank you and giving anyone here who hasn't already had the opportunity to schedule a free consultation. This is available for individuals in the United States. Go ahead and scan the QR code on the screen or check the link in the chat. I'd love to just hear a few words of appreciation or something that stood out for you in this summit. So if you were able to stick around for a few minutes and just write something in the chat of what stuck out for you, that would be great. And if you're now going to sign off, we're here for you. Don't hesitate. If you already have devices on the ears, consider us at Treble Health for your next pair of devices. If you need help with tinnitus, reach out for us now, as well as make sure you're following us on YouTube, where we have a lot more content like this. a lot more videos to keep this hope and positivity in your mind, as it really does help. I want to give a shout out to all the speakers today. Mike, Dr. Suzanne at Treble Health, Dr. Priscilla at Treble Health, Dr. Out of the San Francisco clinic, Dr. Trisha out of the Weston, Florida clinic at Treble Health, as well as Steve. Maria says, wow, where did the time go? This was so informative. Thank you, Dr. Ben and the Treble Health team, for everything you do for our tinnitus community. I'm about 5 to 6 weeks in on my recovery. Dr. Michelle at Treble Health is a sweetheart. Thank you, Maria. Appreciate you. Joe says, thanks, Dr. Ben. I appreciate your tinnitus sound therapy on YouTube. It helps a lot. Maria says, I would like to make an appointment in Weston. Maria, please do. We'll put our link below to go to our Weston page on our website. For people outside of the United States, if you did want to discuss working with us, we would consider that. Send us an email, contact@treblehealth.com. If anyone else has any further questions, then please do send us an email, contact@treblehealth.com. Cheryl, hope to see you in Charlotte. Come by. Doug says the YouTube videos are great. Also, the group counseling is a nice resource and practice. Patricia says, I use your sound therapy videos on YouTube at night when I can't sleep. I appreciate you, Dr. Ben, and your team. Thank you for all you do. I'll definitely be scheduling a consultation. All right, guys, thank you so much and have a good rest of your evening. We're going to sign off, so go take care of yourselves. And please put some of this into practice. That's why we're doing it. All right, thank you all so much and take care.